Welcome back, everyone. We're back for our second portion of the Tuesday, September 8th City Council meeting. We are back for our evening session after our brief recess, and we're going to start off with scheduled delegations. I believe we have 2 delegations that let us know in advance that they wish to present this evening. The first is Rhonda Huco from Elcan Environmental Engineering. Rhonda, and I'm sorry I've forgotten your colleague's name, but welcome. We see you on screen. We will invite you to turn your microphones on, and I think you remember the procedure from last time. Our recording secretary will put a 5-minute timer on. We'll invite you to make your presentation, and from there we will have an opportunity for council to ask any questions. Okay, welcome.
Thank you very much, Mayor Bill Gibbons. I'm just going to share the screen. No, here's ours. Okay. Can everyone see your presentation?
No, we can't right now.
Might just be delayed.
You have too many.
Mute yours.
Unused mine.
Yes, you're on music. Can you hear me?
We can hear you, but we can tell there'll be some feedback. It sounds like one of your devices is putting out sound and the other one's picking it up. So you might want to make sure that whoever's muted it also has their speakers muted so it's not outputting sound. And I'll just check to make sure with our admin team, have we given Ms. Huco screen share capability? Director Bork?
Yes, we have.
Go
ahead, Director Bork.
Yes, we have. I do have a copy of the presentation that I could share if so desired.
Okay. Ms. Huco, are you comfortable? Have you got your screen share up yet?
Okay, so the screen share, I'm just sharing it right now.
Okay, that looks like that's got it.
Okay, great.
So again, I'll just ask you to keep an eye on that 5-minute timer. When it does get to 5 minutes, I will let you know, and we'll ask you to conclude your presentation at that point.
Thank you, Mayor Bill Gibbons. Thank you for an opportunity to present on our concerns with face masks. Again, this is part 2, dealing more with medical information on concerns with face masks. You're familiar with Ken Santo and myself again, so I'll just fly through that. So just looking at our current stats for Grande Prairie right now, we've got a low active case number of 0.022% right now. And the current stats for Alberta, you're going to see us present that on the next screen. The graph appears to show that for approximately 70% of Albertans requiring face masks, there's no statistical difference. So looking at the graph here, we're looking at cumulative versus active cases in Alberta. We do have a blip in May. Things settle down in June and July, and I'm sure you've seen these graphs. Currently right now, as of August 1st, up to September 7th, we're seeing no statistical difference in the use of face masks that are mandated in other parts of the province, such as mainly Calgary, Edmonton, which comprises a large part of the Albertan population right now. Now looking at Canada as a whole, as of August 29th, these stats are, there's a kind of 3, we'll break them down to total COVID cases in Canada, 5.4 million, total positive cases, about 127,000. So as a percentage of positive cases, we're seeing 2.36%. Now the second stat is total COVID deaths. We're right now at about just over 9,000. So the death rate as a percentage of positive cases is 7.14%, and as a percentage of total COVID cases, 0.17%. The third stat, we're looking at active cases, just over 5,000 cases right now in Canada across the country. So the COVID mortality rate results in 0.024%, which is the active cases in a population of about 37.7 million. Now, if we look at that, the reverse stat, a chance of not dying from COVID is 99.976%. So thankfully, for us in Canada, the statistics are really quite low. So some comments on face masks, laboratory tests showing the penetration of particles through cloth masks compared to medical masks to be 97 versus 44%. The rates of all infection outcomes were statistically significantly higher in the cloth mask arm compared with the medical mask arm, which was more the premise of our first presentation, this slide here. Also, not only do face masks fail to protect the healthy from getting sick, but they also create serious health risks to the wearer. This is from Dr. Bylaw. By wearing a mask, the exhaled viruses will not be able to escape and will concentrate in the nasal passages. So the bottom line is, if you're not sick, you should not wear a face mask. Looking at some more statistics, this is again in Alberta, confirmed cases, just over 14,000 as of September 4th. We're seeing again lower numbers in June and July, and again some increasing numbers in August and September when face masks has been mandated across a large proportion in Alberta. Also looking at another interesting statistic, in June and July, our recovery seemed to be fairly low. August and September, interestingly enough, the recoveries are starting to increase again, thankfully. And so why is that? Well, we think right now the pandemic fear has been lessened by doctors' learnings on COVID routes of infection, rapid diagnostics, and potential treatments. So just a few citations where many doctors are noticing patients have dangerously low levels of oxygen. They are now providing oxygen monitors to patients before they need emergency care. There's antiviral medication that's now authorized with conditions by Health Canada for the treatment of patients in Canada with severe symptoms. There's anticoagulation theory that may be associated with improved survival among hospitalized patients. Also, there's a medication that may be a potential actionable target, cytokine, to treat COVID-related acute respiratory distress syndrome. As well, colchicine may be used to reduce the excessive inflammatory reaction that may lead to, again, acute respiratory distress syndrome, also organ failure and death. So just some comments from Kent here on an interesting little icon.
Just want to see if my mute is not coming off. Good evening. Yes, I just wanted to add that the decision to wear masks is you're making to society as political leaders is under the assumption that you're improving the well-being of the community. But at the same time, when you make that decision, you're also affecting adversely the community, and probably in equal percentages. There's no evidence out there, or nobody's doing statistical analysis of the people who have compromised health issues that they can't wear a mask because of mental or other physical.
Kent, I'm just going to break in to say that we have gone over the 5 minutes by a fair bit already.
Subjected to conditions that are ridiculing, dehumanizing.
Sorry, Kent, I just want to confirm that you can actually hear me.
And I come that from a personal experience. My daughter and
Ms. Hugo, can you hear me?
had to go to a medical appointment for a job, and
so I'm not sure if the delegation can hear me or not. So I'll ask administration if they could maybe pause their audio.
And had a panic attack because they forced her to wear a mask while she was getting her testing done.
Thank you very much. So Rhonda and Kent, we've muted your audio. We had been over the allotted time, and I'm not clear if you can actually hear me on your end.
I might point out, Mayor Gibbon, that you did ask him to turn off his speaker to stop echoing.
Yeah, it would appear they both turned off their speakers, so now they can't hear the rest of us. I will just... So I'm going to ask our administration. It seems that the delegation has turned off both of their speakers, and so neither of them can hear us speaking now. So other than waving to get their attention, which I'll do. Ms. Hugo, we've actually muted you. I'm not sure if you can hear us, but you are over your time by a fair bit. And so what I'm going to ask is that administration hide the delegation's video, and if somebody from administration could send a message to them using the Zoom chat function to let them know that we'll invite them back in so council can ask any questions that they might have of the delegation. Okay, but in the interim, we will move to our next delegation that let us know in advance that they wish to present. So administration, if you can, thank you. Okay, and so I believe we have another delegation that had intended to present to council. And that was Alana Walker. Alana, if you are on, if you could turn on your camera and audio. Welcome. Alana, so you saw sort of how that runs. We will put up a 5-minute timer. And so can you see that timer that's going there?
No, but I have one here to time myself.
Okay. Well, and you saw that I didn't cut the delegation off immediately. We will try to give you a little bit of grace, but you also saw that if it does go on too long, I will break in. We do want to leave some opportunity for council members to ask any questions if they have any after your presentation, okay?
All right, perfect.
Okay, welcome.
Thank you. Hello, Council. Thank you for the opportunity to speak and share my perspective. My name is Alana Walker, as you heard, and I speak today on behalf of the members of the Grande Prairie community who are in support of mandating masks in indoor public spaces. I have prepared a semi-formal speech to present to you today. In this speech, I will touch on 4 points. They are the cost effectiveness of preventative measures such as masks, examples of preventative measures equivalent to mask wearing taken by citizens every day, the balance between one's freedom of choice and the collective's right to life, and one's moral obligation to protect the community. Regarding the cost effectiveness of mask usage, I present you with these statistics. One box of 50 disposable masks costs $30, coming out to 60 cents per mask. A good reusable mask can be purchased for $20 on average. Next, I will tell you about the average cost of an ICU visit. Based on a study called The Daily Cost of an Intensive Care Unit Day, the Contribution of Mechanical Ventilation, it was found that the first 2 days of an ICU visit cost on average $15,000, with the price decreasing to around $4,000 per day from there. Counselors, were those $15,000 and more spent on masks, they could provide at least 25,000 disposable masks or 750 reusable masks. This means that masks are more cost-effective for the public health system than our ICU visits. If even one mask prevented even one ICU visit, the cost would be 60 cents and the saved cost would be $15,000. Therefore, it is in Grande Prairie's best economic interest to mandate masks in indoor public spaces. Next, I will provide examples of preventative measures taken by the average citizen, which are equivalent to mask wearing and which in no way inhibit anyone's freedom of choice. These are speed limits, wearing seatbelts in cars, helmets on motorcycles, and following the direction of traffic lights. These and many more preventative measures present in the law are in no way limitations of freedom. Any person can choose not to abide by the speed limit, etc. That is their choice, and the risk they take for both their well-being and their finances is their choice too. There is no difference between these examples and the mandating of masks. Everyone will still be able to choose for themselves. There will just be risks associated with choosing not to abide by the proposed preventative measures. I will mention here that in Edmonton, where masks have been mandated in all indoor spaces, a fine of $100 is given to any citizen caught not wearing a mask in the required places. On the topic of freedom of choice, I implore you, Council, to consider that one's freedom of choice has always been balanced against the collective's right to life. The voices crying out for freedom have forgotten or else do not care that their failure to wear masks and thus to increase the transmission rate of COVID-19 will result in a loss of life in the community. I ask you, is the comfort of one more valuable than the lives of the many? And what does our community stand to lose if masks are or are not mandated? I will tell you, if masks are mandated, our community stands to lose some comfort. If masks are not mandated, our community stands to lose lives and money. Thus, my final statement is about the individual citizen's moral obligation to protect the community at large. I understand that anti-mask arguments are coming from a place of fear and self-preservation, ideas which every human being can empathize with. To best address these concerns, I will say this. It is not about the individual themselves, or at least it does not have to be. If wearing a mask for oneself makes no sense, then consider wearing a mask to protect others. This is a call to action, to make the decision that protects one's neighbors as though they were oneself. I, as much as anyone, want to see this community thrive, to beat back COVID-19 and return to normalcy, and to protect the people I love. I could speak about my family members who would die if they contracted COVID-19, and I could beg everyone to think of them. Instead, I beg everyone to think of their loved ones, the ones with asthma, the ones who are of old age, the ones with compromised immune systems, and even the ones who would suffer dire consequences from the virus despite being of good health. Wear masks for them. And so, Council, I say to you, the fate of the community with regard to whether or not they decide to protect their loved ones and to abide by their moral obligation to protect the community rests in your hands. You have the power to mandate masks in indoor public spaces. That is all. Thank you for your time.
Thanks very much for the presentation, Ms. Walker. You had time to spare. Well done. So opportunity for any questions for the delegation. Was there anybody that had any questions for the delegation? Yeah, Councillor Clayton.
Thank you, Mayor Given. Question, I'm curious on your expectation of masks. Is this a mandate masks immediately? Is there any trigger point? What's your thought in regards to when masks start, if they start at all?
My personal opinion is that they be mandated as soon as possible. As I said, I don't see what there stands to be lost with the mandation of masks beyond some people's comfort. That being said, sooner is better than later, and anything is better than nothing. And I know that there are people advocating for no mandating of masks ever. So I think that even if there was a trigger point that would do that, it's better than nothing, even though personally I would like to see them mandated immediately.
Thank you.
Okay, thank you. Any other questions for the delegation? I don't see any other council members with any questions for you, Ms. Walker. Thanks very much for making the time to come and speak to council tonight. Thanks for the preparation that you put into your presentation.
Thank you so much. Have a great day.
So Alana, you can turn off your camera and your microphone. You're more than welcome to stay and listen to the council meeting on Zoom if you wish. Thank you very much. I'll just check with administration. We did want to ensure that we gave council members any questions that they had, an opportunity for any questions that they had of our LCAN and of our engineering. Are they back on? Looks like they may just be connecting to audio. Director Bork?
They had logged out, and I believe we're just trying to log back in. So I would suggest give them just a couple seconds here to see if it works.
Okay. Well, I'll just check to see if our LCAN Environmental Engineering delegation is ready to present. I can see that one of the devices with Ms. Yuko's name appears to have an open microphone. Maybe you want to test that and see if we can hear you.
Yes, can you hear me?
Yeah, we can. I don't know if, you know, for the purposes of being effective, we're really, you did pass the allotted time. We've spent some time trying to iron out the technical difficulties, which we're all sort of dealing with. But we did bring you back so that if council members had any questions, you'd have an opportunity to answer them. So are you in a position to be able to do that if council members had any questions for you?
Are there any questions?
So any questions for the delegation? I'm looking around the council chamber. I don't see council members with any questions. No, then that being the case, thanks very much for the preparation that you put into your presentation today. Appreciate the fact that you've come to council twice now to speak on this issue, and really appreciate you making your voice heard. Thank you.
Thank you very much, and sorry for our overtime today.
No problem. Thank you again for coming this evening. Okay, and I don't believe, I'll check with Director Bork, but I believe that was all of the delegations that were scheduled ahead of time that let us know what they wish to present this evening. Is that correct, Director Bork?
That's all that I'm aware of, unless you might want to check with the clerk as well, though.
I believe that's the case. I think that's all that they sent out earlier. Ms. Karbaszewski, just to confirm, just because you're not in council chambers doesn't mean that we don't look to you for advice. Were there any other delegations that wish to present to council this evening?
Thank you, Mayor Given. There are no other delegations on our roster for today.
Okay, thank you very much. So that brings to a close our scheduled delegations and moves us into unfinished business. Item 13.1, Bylaw 1426. We're here on second reading. There have been some amendments made to the proposed bylaw at our last council meeting. I'll just confirm with the city manager if those proposed amendments are included in the bylaw that's in front of council today. Mr. City Manager.
Thank you, Mr. Mayor. I believe so. I will just refer to our city clerk to confirm, but my understanding is that the three different amendments, sunset clause, trigger point, and the incorporation of the word indoor public space have been presented now as part of the discussion for today's council meeting.
Okay. And has administration sought any information from Alberta Health Services or public health officials on the proposed wording?
Thank you, Mr. Mayor. Yes, that is correct. As part of our due diligence, and in order to avoid liability as well for the city, I did follow up with the medical officer of health, Northern Zone in Edmonton, Dr. Catherine Koleaska. Dr. Koleaska was the reviewer of the original bylaw, and as part of her feedback presenting, the medical officer of health provided additional comments. If you are okay, I will read the comments from Dr. Koleaska.
Sure, of course.
Okay, so Dr. Koleaska reviewed the original bylaw, and she provided the following comments supporting the original proposal. Number one, contemplation of a masking bylaw is an additional layer of protection against the spread of COVID-19. Thank you for your efforts in protecting the health of the public. Number two, including both the city of Grande Prairie and the county in the watch threshold makes sense given the movement of people between the two jurisdictions. And number three, you have incorporated clear criteria for when the bylaw would come into effect and also be rescinded. I did also inquire the medical officer of health about more specifics regarding the enhanced status and the 100-case count trigger that is part of one of the motions that Council passed a few days ago. So in terms of clarification about the enhanced status, the information I got from Medical Officer of Health is that enhanced means that there would be further consultation between the government, the provincial government, in this case directly from Dr. Hinshaw, with the local municipality and the local medical officers of health. An example that might trigger this flag would be significant local transmission of COVID, and enhanced local parameters and guidelines would be put into place to control the spread. It is important to note that to date, none of the communities in Alberta have been at this level of oversight. It would be in full consultation with the local leaders of the area that was experiencing challenges containing COVID-19 in order to trigger this enhanced status. In terms of the comments for the 100 active case count trigger, the medical officer of health did comment the following. The chosen threshold of 100 cases, city plus county combined, is an arbitrary number, and the medical officer of health is unlikely to find evidence to support that particular threshold. I reiterate, the medical officer of health, Dr. Catherine Koliaska, reviewed the original bylaw as presented about a week ago, and she is supporting the original wording presented. Thank you, Mr. Mayor.
Okay, thank you very much, Mr. Galante. So Council, with that new information, since Council proposed some amendments at the last meeting, we are open for a motion for second reading, so we can open discussion and debate on the bylaw as amended. So those amendments were approved at the last council meeting, so the discussion and debate, second reading would be on the bylaw as amended. And I would look for a motion to get that on the table. Councillor O'Toole?
I move that we give second reading to bylaw C-1426 at this meeting.
Thanks very much, Councillor O'Toole. That motion gets it on the floor, so we can have discussion and debate. Open for discussion and debate among the council members. Councillor Friesen?
Thank you, Mayor. Thank you, Mayor Given. I would like to propose an amendment that section 4(1)A be amended to reflect the original recommendation of administration that watch status is the trigger. However, within that, I would like to consider watch status as an overall consolidation of city and county numbers. So the 50 per 100,000 would take into account the full population of the city plus the county and the number of active cases in the city plus the county. And I'll leave that to administration to word if the intent is clear there.
I think you may need to clarify the intent. So returning the trigger to watch status.
Watch status, and watch status, of course, is triggered at 50 cases per 100,000 population. That is 50 active cases per 100,000 population. So in that denominator, I would like to, so originally we had in watch status in either the county or the city. What I would like to see is that watch status trigger is on a consolidated, so the denominator is of the 100,000 population is the total population of the city plus county.
Okay, so I'll just look to administration. I'm not sure if this would be the city manager. Actually, I'm going to ask City Manager Galante, who's your expert on the bylaw and how it's structured. I just want to make sure that, if not the exact wording, that the intent that Councillor Friesen is putting forward is clear or able to be captured.
Okay, thank you, Mr. Mayor. So we can craft the proper wording. I just want to be sure we understand the intent. And because the math is relatively simple to make, if just for Councillor Friesen, the city has approximately 70,000 population and the county is about 30,000. So we're talking 100,000 when we combine both jurisdictions. The watch threshold is 50 cases. So could you please confirm if the intent to trigger the bylaw is when combined active counts in the city plus active counts in the county, the number, the final addition is 50?
Yes. Yes, thank you, CO Glanty. Based on those numbers that you just gave of the 70,000 plus 30,000, coincidentally is 100,000, in which case the trigger would be 50 active cases in the two municipalities.
Okay. If that is the intent, it's clear, it's understood, and we're looking at city clerk to craft the proper wording. We can craft the proper wording, but the intent is clear. Thank you.
Okay. I see people will likely have some discussion, debate on that. So now that we're just clear on the intent of the motion, which I'm just looking in the council chambers to see if people are clear on the intent of the motion. Okay, so I'm getting head nods from all my council colleagues in the chambers saying that we're clear on the intent of the motion. Councillor Blackburn, I do see you. Councillor Friesen, I know you can speak to the intent of your motion, and then we'll go to discussion and debate. Go ahead.
Thank you. So to speak to this motion, this amendment, I looked at Dr. Koliaska's original support of the her support of the original proposal, which was including both the county and the city in the watch threshold, making sense given the movement between the two areas. I also heard from a number of county residents and city residents that there is a lot of movement, in particular from county residents who are concerned that they are in the city daily or they have family members in the city, and they agreed that it made sense to include the two. So I left that consideration in, but my rationale for doing the combined was that in the event the county alone hits a watch status that's fairly low number of cases, that the city would then be triggered, the bylaw would be triggered in the city. If we're considering the fluid movement, it just makes sense to simply combine the populations and do the math based on the combined population numbers. And to speak to going back to the original recommendation, I'll now refer to Dr. Koliaska's comments on the 100 case trigger point that actually was my motion last week. The question arose that came forward is that what is the evidence to put the number at 100 cases? She states that the threshold that the province uses is based on a jurisdictional review and therefore is based on data and information on spread. And that what in effect we had done at 100 is created a threshold that doesn't align with provincial thresholds. So those that is my rationale for going back to being more in line with what administration originally recommended to us, but bringing that overall perspective of consolidated numbers. Thank you.
Okay, thanks, Councillor Friesen. So I saw in the room Councillor Friesen, and then I'll go to Councillor Blackburn. Councillor Friesen.
Thank you very much, Mayor Given, and thank you for the motion, Councillor Friesen. I'm actually not going to support this motion, and just sort of to put it bluntly, I ran a couple numbers really quick. So as our CAO mentioned, and as was in the email that was presented to Council earlier, there is no real standard set for the enhanced version of Alberta Health Services, like how to deal with COVID stats. I was looking it over, and I thought the biggest COVID outbreak in all of Canada happened in High River. back not too long ago. As of May 3rd, there was 921 cases of COVID-19 infections in High River, a town of 13,584. As of August 11th, High River's Town Council voted no to mandatory face masking. Now, the only reason why I bring this up is because 921 is an extraordinary number. In fact, it was the largest in our entire country. We're talking about 100. 921 out of 13, almost 14,000 people. Seems to me like it should have activated an enhanced level of response from Alberta Health Services and our provincial government. We're talking about 100 with a population threshold at about a fifth of what it is in High River. So to drop these numbers back down to 37 and 16, I believe it was in the county originally, based off of that, I think it is an arbitrary number as well. It's an arbitrary bare minimum. And I'm not a virologist and I'm not an immunologist. I don't understand all this stuff, but 37, if 100's arbitrary, I find 37 to be a very low arbitrary number, especially when we've had a level of outbreak almost in the 1,000 number of people in a small town in Alberta. So for all those reasons, I will not be supporting this motion. Thank you.
Okay, thanks, Councillor Friesen. Next, I'll go to Councillor Blackburn.
Thank you, Mayor Given. Am I speaking loud enough to be heard?
You are.
Thank you. I do have one question of clarification that I would like to hear Councillor Friesen's comment on. Are you anticipating that the province would cooperate and put a watch on both the county and the city if that 50 per 100,000 were met? Or are you intending that we would simply use that number, whether we actually put on watch status or not?
Councillor Friesen.
Thank you, Mayor Given. Councillor Blackburn, it is irrespective of what the province may decide to do in either jurisdiction. It is just our calculation that matches the 50 per 100,000 recommendation. We're not asking that they also follow suit and then consolidate on their reporting.
Thank you. If I may, Mayor Given, I just want to comment that I'm glad that we're moving away from the arbitrary number of 100,000, of 100, because we're not epidemiologists, and so for us to be trying to decide on numbers without any kind of medical knowledge is probably not something that would be acceptable to the public. And if we want support for this bylaw in the long run, then we ought to be doing it based on the medical recommendations that we've been receiving from the province. So I am going to vote in favor of this amendment. Thank you.
Thanks, Councillor Blackburn. I see Councillor Palat, and then I'm going to go, and then I'll have Councillor Clayton and Councillor O'Toole. Councillor Palat.
Thanks, Mayor Given. This is one of those ones I can appreciate the number of 100 was arbitrary. I'm not so sold that the number of 50 is something that's I'm a believer of either. And so for me, I can't support this. I would support the original motion, and a week ago I probably wouldn't have. But I think what I'm finding on council is, in my 3 years, is you're always trying to find a balance. And I think for me, the 100 and the proposal that's in front of us, our community's had a week now to digest it. I also think it's a balance, and it's a balance of the anti-mask, the pro-masks. I think 50 is too low. My biggest concern with 50 is one outbreak could change that. So one house party could change it for the entire city. One business could change it for the entire city. And I don't think that's fair to the rest of the community to have one outbreak be the difference of this. So I'd like to see us just go back to defeat this motion and go to the motion that's sitting on the table that was originally proposed by Councillor O'Toole, that we'd make second reading of what's sitting in front of us. Thank you.
Thanks, Councillor Platt. I'll say that I support the amendment, and I guess the observation that I have is that it is different than the original bylaw. The original bylaw would have been triggered when either the city or county went to over that ratio of 50 cases per 100,000. This basically allows for, if the city is doing a really great job, but there was a big outbreak in the county, that would not automatically trigger the city to go into the requirement for the mask bylaw. So I appreciate the recognition that what impacts one municipality does impact the other, but that we don't necessarily move at the same pace, and that we need to look at the region as a whole. And so I think the idea, so the epidemiologists have identified that rate of 50 cases per 100,000 population as the magic number. That's what the watch status is built on. What we're doing here with this proposal appears to recognize our region together and say, well, if one part of it is low and the other part is high, we need to look at what that total is, rather than triggering something in the city because it was high in the county, or vice versa. So I appreciate the regional approach to this. I think it's consistent with the idea that's put forward by Alberta Health Services, the Medical Officer of Health, that 50 cases per 100,000 population is where you start to need to, if not get into that watch status, to start to watch what's going on. And so for those reasons, I think this is an appropriate approach. Councillor Clayton and then Councillor O'Toole.
Thanks, Mayor Given. As mentioned by some of my fellow councillors, we aren't scientists, we're not medical professionals, we're simply politicians that have been elected by the residents of our municipality. And I think that it's really important to recognize that because we're not scientists, to have this decision put on us is a really tough decision. We can read as much data as we want, and data can be interpreted many ways. I think that the provincial thresholds, although they've been set at the 50 per 100,000, there's also been no consideration for regionality in that. And I think that our region has done an excellent job of managing COVID. We haven't had a huge number of cases. I think that in addition to masks, there's other provincial guidelines that are as effective as masks. Social distancing is as effective as masks. And I think that we need to recognize that studies have shown that transition can be reduced by 20 to 70% with the wearing of masks. If it's 20% on our number of cases, it's such a small number that I think that I see no need for masks. If somebody could tell me for sure that it was being reduced by 70%, then I'd be more inclined to support the masks. I think that number of 100, although it may seem arbitrary to some, we're not a medical professional, I'm not anyways, to come up with a number that's very scientific. If the province wanted us to support a scientific number, then the province should have mandated that number for us. And so for me, I'm okay with the number of 100 because I'm representing the people that elected me, and the people that have elected me, and as many emails as we've received, I didn't receive a single one that said 100 is the wrong number. I received emails that people that support mask wearing and emails from people that don't support mask wearing. But no emails that I received said 100 is the wrong number, other than from one doctor, fair enough, at AHS said the number is arbitrary. And yes, the number is arbitrary. But I think that number is a number that we can be comfortable with, and I support the original motion. Thanks.
Okay, thanks, Councillor Clayton. Councillor O'Toole.
Thank you, Mayor Given. Did we get full support from the county on this partnership deal? Are you aware of at this time?
I will look to the city manager on that. I believe he's been in contact with the county. Obviously, one thing before Horacio has to say it, obviously the city of Grande Prairie can only pass a bylaw that applies to city jurisdiction, but I don't know the state of the discussion with the county of Grande Prairie. Mr. Galante?
Thank you, Mr. Mayor. I had preliminary conversations with my counterpart at the county, and they're preparing some discussions at the council level during the near future. I don't have a specific date when they may be discussing this matter, but in our preliminary conversations, we agreed that a regional approach made sense. Because the city was taking the lead on preparing the bylaw at that time. I'm talking between 2 to 3 weeks ago. The regional approach made sense in our CEO conversation. So other municipalities in the region as well, like Hythe and Sexsmith, they are discussing this matter, I believe, during this week or in the very near future as well.
Okay, thank you. I've got the same emails as you have. I've been basically verbally abused and almost point to were physically abused, because we need to make an answer. And I just want, when this is all over with, I would just like people to practice social distancing, use proper hygiene, no verbal abuse, no pushing or physical abuse, but just show respect for each other when this decision is done at the end of the night. And we'll decide what we're going to do here tonight. Thank you.
Okay, thanks, Councillor O'Toole. Councillor Bressie, then Councillor Minhas.
Great. Thank you, Mayor Given. It definitely has been a challenging conversation that I know we've been having as a community, and I know that we've had many emails on both sides of this issue, although I will acknowledge more emails saying please don't mandate this, but also still well over into the couple hundreds, I think, emails saying please do mandate this. Last count I heard was over 130 saying please mandate this. I also know that for about a month now, I've been talking to everybody. Literally, if I've had a conversation with somebody, I'm likely to end it saying, hey, what's your take on this mask thing? And I know that the best way for me to get a random sample of our population is spending time at doors, and I've done some door knocking this month. And it really is, our community really is split on this. But at the end of the day, I think the people that I think are the most important to listen to are our medical experts, are the people that have education and experience in public health and epidemiology, and the people that have access to the data about what's actually going on. Where there's us as council and our city staff, the only access we have to know what's going on in the community is the same the public has, which is just how many are in our community right now. We don't know where they came from. And if you've got 50 cases in our community, but they've been linked to 2 family gatherings, and we know everybody's isolated, and by the way, 20 of those cases are way out near the glass with people that never come into the city, that's such a different story than if you've got 50 cases all around the community that came from, we know where 40 of them came from, and 10 of them, we have no idea where that came from. And that information makes such a big difference. And for me, I really am coming down to, we need to trust our medical experts with education, experience, and access to data to be guiding these decisions. And my understanding of the watch triggers is that the watch isn't the medical experts saying, hey, we're suggesting more restrictions for our community. Right now, we are living under a lot of restrictions. When you go into a store, when you operate a business, it's not the same now as it was last September. There are a lot of restrictions in place to mitigate the potential spread of COVID-19. And my understanding is that the medical experts with up-to-date data are watching the impact of those restrictions. And if we hit watch, my understanding is that's not the experts saying, hey, we're recommending more restrictions in your community. That's them saying, hey, we're going to keep a closer eye on our community, and we might be getting to the point of saying there should be more restrictions in our community. I really struggle why we would put in more enhanced restrictions when the medical experts with the data we don't have aren't asking for it. And so I really do strongly believe that enhanced should be the trigger. And for me, it really does come down to, do I trust our provincial medical officers of health to call enhanced when they need to or not? And I think that looking at the response we've had in this province and looking at how our community has weathered COVID-19 so far, I think I really do trust them right now. And so for me, I really can't support a trigger that's not tied to the recommendation of the experts with data. So I'm sorry, Councillor Friesen, although I appreciate that this is in many ways better than the 100 trigger because it's actually tied to something the experts are doing. Still, it's the experts saying, watch your community, not bring in more restrictions. So I can't support this.
Okay, thanks, Councillor Bressie. I see Councillor Clayton. Oh, sorry, excuse me, Councillor Minhas. Thank you. Councillor Minhas.
Thank you. I'm really struggling on this issue, and I'm listening to everybody. I missed the conversation the other day because I had to leave. But talking to the people, it's not favoritism to the mask and all the medical, whatever they put 50 for 100,000. They have no data on this. There are nothing supported. And even Edmonton, they did the mask, and there's still the cases going up. So even if you do mandatory, do it. For me, it's very hard to do it because personally, I don't like the mask. I mean, wearing it, and I talk to a lot of people, they don't. And a lot of people in the favor, especially young people, they are more aware about the people are educated. They're wearing the mask already, a lot of places. And a lot of places they're recommended to going to the store or someplace they ask you to wear the mask. So I don't know, I go with the recommendation, but I'm okay with the 100. There, I'll go the first motion to the 100, but I don't know, I can't support the 51.
Okay, thanks, Councillor Minhas. Councillor Clayton.
Thanks, Mayor Given. Although I don't support the amendment, I truly appreciate what Councillor Bressi is saying, and if this amendment is defeated, I'd be willing to speak against the motion overall at 100. And one of the biggest things for me at probably the biggest concern I have with the number is that it doesn't take into consideration rate of transmission, rate of infection, or as Councillor Bressi addressed, isolated cases. And so if we were to have, a pocket of, because it is inclusive of the county, if we have a pocket of 20 here and a pocket of 20 there, and they're isolated incidences that can be managed, that number could quickly accumulate to be 100, but it doesn't necessarily mean that we have such a rate of transmission that it's something to panic about, because it could be very isolated cases. And so on the other hand, if we had all of a sudden there was 30 cases that showed up in one day and there was no direct route of where these cases came from, although it wouldn't be near 100, it could be it's a very strong reason to be alarmed. So I think that the 100, although it doesn't incorporate any of those considerations, I think that if there was a follow-up motion, if this overall motion of 100 was defeated, I would support, as Councillor Bressi had mentioned. Thank you.
Okay, thanks, Councillor Clayton. So I'll just we'll refresh everybody where we're at. Councillor Friesen has proposed an amendment to second reading. So we're discussing, debating Councillor Friesen's amendment, which essentially would change the trigger to be a combined active case count equal to 50 cases per 100,000 for the city and county total. And so that's that ratio. So that's what we're discussing and debating. If this motion passes or fails, then we would go back to second reading, as is in front of us, which has the total number of 100 cases. If that fails, if second reading fails, then the city will not be able to have such a bylaw for 6 months. So if a bylaw is defeated at second reading, then there's no such bylaw for 6 months. So if there's a different number that council is thinking of, then they should, the advice would be to actually do that here, rather than to defeat second reading. Second reading defeat means that we are not able to bring forward such a bylaw for 6 months. So just to clarify, it's not about voting against the second if this one doesn't pass. I will just, make one last observation with respect to, the advice that we get from experts. We have all seen over the last while information from the folks in our transportation department, data about how faster speeds lead to greater harms. In a collision, a faster speed leads to greater impacts, and greater impacts lead to more injuries and greater harms from that collision. We, on that advice, have seen fit to say, hey, we need to ensure that we do what we can through engineering, enforcement, and education to try to help people drive slower so that fewer people are harmed, or fewer people have less significant injuries. So I think that's a really good example of where there's some underlying science that we haven't dove into, and there isn't a specific number that we're trying to achieve, but we do know that slowing the speed on the roads leads to better health outcomes for people. And so for me, I appreciate that none of us in the room are epidemiologists, but we have received advice that says, this is the speed limit that you want to start thinking about how you can keep people to that in terms of the rate of cases per 100,000. That's why I support the 50 cases per 100,000 for our region. I think that that's, for lack of a better term, sort of a good indicator of a speed limit that we should be aspiring towards. I hope that we'd never have to reach that. But if we did, that would be a good indication that we need to take our foot off the throttle a little bit and try to slow the spread as much as possible. So for those reasons, I support it. I would just, make the observation too, when we look cross-jurisdictionally, the news out of BC just this afternoon is that once again, they are closing all nightclubs and standalone banquet halls. So the businesses in BC are suffering a direct, immediate impact because cases are getting out of control and the provincial government has decided to act. I would note the provincial government didn't decide to act to bring in face coverings for the entire province. What they chose to do is close down businesses. And so my preference would be that locally we use some tools that we have at our disposal that allow the best chance for businesses in our region to continue to operate, even if it means some discomfort for us as individuals from time to time. So for all those reasons, I support the 50 cases per 100,000. I would encourage council to support it as well. Is there any other discussion or debate on Councillor Friesen's amendment? I see Councillor Minhas and then Councillor Bressie. Councillor Minhas, Councillor Bressie, and then Councillor Blackburn.
I'd like to clarification on this one. So, okay, example, if we pass this bylaw with the 50 cases, what would happen like if you go 54 and next day you go to 48? You're going to have 1 day mandatory and next day you taken off, or how it's going to work out? I just need the clarification. If we go over 50, if we pass this one.
Thank you. I see our city manager's joined us. Mr. Galante, if you can clarify for us.
Yeah, for sure. Thank you, Mr. Mayor. Just to clarify, Councillor Minhas, your question. So the bylaw is written in a way that if the decided trigger point is reached, then for at least 14 consecutive days, the bylaw is in effect. So just to give you an example, let's suppose that tomorrow, between the city and the county combined, we reach the threshold, the bylaw is in effect. But 3 days later, the numbers go down. There are many recoveries, and the numbers are below the threshold. The bylaw still will be in effect for 14 consecutive days after that day. If in that period of time, the cases go up again, then we reset the clock, and the 14-day mark starts again. So we did this on purpose for two reasons. One is the incubation period is 14 days, and also to allow administration to communicate to the general public via multiple social media channels, so we can reach all segments of the population when the bylaw is in effect or not. We don't want to create fatigue or misunderstanding if the bylaw is in place or not. So a period of 2 weeks will give us enough time to escalate the current public information campaign we launch on August 24th and properly communicate to the general public if the bylaw is in effect or not. Thank you.
Thank you.
Thank you, City Manager Galante. Councillor Minhas, that's answered your question for now?
Yeah.
Okay, so next I have Councillor Bressie, Councillor Clayton, and then Councillor Blackburn.
Thank you. You know, it really strikes me that when we're talking about public health and epidemiology, that part of it's the medical science of how do diseases spread, and part of it is the sociology and the psychology of how do people take that medical advice. And I'll note that my understanding of the expert advice on face masks is that they do seem to help the spread, but they exist for when social distancing and hand hygiene and cohorting and all those other measures fail. And for me, I actually really do have a big worry that if we mandate masks before the experts tell us we have to, or so I shouldn't even say before, if we mandate masks and the experts never tell us to, and if there's a widespread perception in the community that this is overbearing, well, sure, I'll wear a mask because that's one thing they can make me do, but I'll feel a false sense of security that shouldn't be there because masks don't protect us the same degree as social distancing, or else I'll just choose not to do those other things. And we've seen that in other municipalities in Alberta where we've seen massive spread after mandatory mask bylaws happening at private events and happening at places that would normally fall outside of the bylaw. And I really wonder if that's why when we've got Dr. Hinshaw imploring people to voluntarily wear a mask. That's advice that I do take seriously. I do have a mask in my vehicle, and if I'm going to a store where I can't socially distance, I do voluntarily wear a mask because Dr. Hinshaw is saying, hey, this is a good way to protect your neighbors. At the same time, I don't see her, I'm not aware of her making any recommendation to any governments to mandate masks as much as she implores people to voluntarily use them. Also point out the AHS Scientific Advisory Group, which is made up of clinicians from a variety of disciplines. They note in several documents, not just their document relating to the use of cloth masks in the community, but also I noticed the same line about cloth masks in their paper on what's the likely spread of kids in school. They point out that there is a split on that community on whether or not cloth masks in the community should be recommended. I look at the World Health Organization, and their recommendation on masks isn't that they should be worn in all general population situations. The WHO's recommendation is that cloth masks should be worn by the general population in areas with known or suspected widespread transmission and limited or no capacity to implement other containment measures. And why the experts are imploring us to voluntarily wear these without imploring governments to mandate them in this province, I don't really know. And it's really frustrating as anything to me that we have to make this decision without without great access to those experts. But for me, from a sociological and from a psychological view, and us politicians, I'm not going to pretend I know better than the experts about the science of how the virus spreads in droplets. I think we as politicians do have some insight, though, into how the people of our community respond and behave and how they choose to do different behaviors. And I really do worry that if masks are mandated when there's not a medically expert-driven reason, I really do worry that we could lose ground on other measures that we know are more effective than masking. And that's the thing that concerns me most about this conversation. Are we losing ground on social distancing, on hand hygiene, on staying home when we're symptomatic? And that's why I really do take this expert advice seriously, and I just can't support this without the experts telling us, please mandate, please bring in more restrictions.
Thanks, Councillor Bressie. I've got Councillor Clayton, Councillor Blackburn, then Councillor Thiessen.
Thanks, Mayor Given. A question for CAO Galante. If the motion, not addressing the amendment right now, but if the motion as presented in front of us tonight is defeated and we're not allowed to bring back a bylaw pertaining to this topic for another 6 months, where does that leave us? Are we strictly at the hands of the province? Where does that leave us going forward?
City Manager Galante.
Thank you, Mr. Mayor. Yes, that is correct. Pretty much there is no local influence on this matter. If the cases vary, going up, then at some point the province may intervene with different measures. Some jurisdictions across the country are deciding specific activities to be reverted to March or April thresholds, like in British Columbia, as the mayor mentioned, for some activities like nightclubs and banquets. Other jurisdictions across Canada are taking different options to control the spread. So we will be at the mercy of pretty much provincial authorities to decide what kind of measures to implement in our jurisdiction.
May I have a follow-up?
Thank you.
Yeah, Councillor Clayton, follow-up.
Thanks, Mayor Given. So in turn, would that in essence leave us at the enhanced status? Is that not the same thing?
No, not necessarily, because we don't have information about what enhanced means in terms of potential closures. Back in March or April, we were under a lockdown, so there was no definition of enhanced status at that time. So after that, the province developed the Open Watch and Enhanced system to monitor different jurisdictions. So I can't assure you if the province will trigger that and what would be the effect. What I'm seeing across the country is locking down specific activities. So I can't say what Alberta may do at that time if they may lock down certain activities before even triggering enhanced. Enhanced has not been used so far in any jurisdiction, even in Calgary and Edmonton so far. So that is an unknown at this time.
Just one follow-up, Mr. Galante. This, however, doesn't take away our opportunity to declare a local state of emergency. So although if the 100 motion was defeated. So the 100 cases, the motion that's in front of us was defeated. If the amendment was defeated and the motion for 100 cases was defeated, and as we weren't allowed to bring anything back for 6 months, it would still allow us the opportunity, if our caseload became something that council or our director of emergency services was concerned about, we would still have the opportunity to trigger a state of local emergency, correct?
Yes, that is correct, Councillor Clayton. Under state of local emergency, the municipality has extraordinary powers. So will be an option to enact a directive at the time on the community to mandate specific circumstances like mask or other specific measures to protect the community. We declared a state of local emergency for about 2 months at the beginning of the pandemic, and we had to utilize some of the extraordinary powers. At this time, there is no state of local emergency declared in the city, but it's another tool available.
Thank you.
Thank you.
Okay. Next, then I have Councillor Blackburn and then Councillor Friesen.
Thank you, Mayor Given. I might make the same arguments again when we get to the main motion, but in terms of this amendment, people may not agree with me, but I truly believe that we are on the verge of a second wave, and I think it may be quite serious given the ways that we've implemented school opening in Grande Prairie. And so I wonder why we shouldn't be proactive. If we're going to be proactive, then I would rather see a lower number than a higher number as a trigger point. And I'll just mention that in listening to the CBC News this afternoon, there was an interview with an epidemiologist from Halifax who pointed out that numbers can escalate very, very quickly if an outbreak occurs. And so the lower the number is, the sooner we would be in a position to suggest that people ought to protect one another by the wearing of masks. So again, I would urge Council to approve the amendment proposed by Councillor Friesen. Thank you.
Okay, thanks, Councillor Blackburn. Councillor Friesen.
Thank you very much, Mayor Given. I'm going to push back a little bit on Councillor Blackburn here, and I'm going to agree with Councillor Bressie in the fact that I'm a big believer that masking in itself is an enhanced measure. The province of Alberta and Alberta Health and Alberta Health Services have had over 6 months to prepare for this, to prepare good solid numbers and reasoning behind the recommendations to municipal leaders, to the provincial leaders and to our federal leaders. To date, no province or the country of Canada has mandated masks. They put this on our plate. We've given public health the authority 100% through this pandemic, both nationally and provincially. They have dictated a lot of how our lives have gone. I find it interesting today as we sit on a precipice here in our council chambers, we can get an email from Alberta Health Services, but we can't get a representative to clearly dispute what we are trying to do here, whether that's setting an arbitrary number of 100 or not passing a bylaw at all. I would like to just point people to the stats that are like pretty bold and pretty simple. If you go to the Province of Alberta website, as of July 31st, the City of Edmonton had 1,677 total cases throughout the entire pandemic of COVID-19. As of August 1st, when they mandated mandatory face masking in public spaces, up until today, we now have 3,660 cases in Edmonton alone. So in just a little over a month, even with the mandated masks, they've more than doubled their own municipal numbers for COVID-19 infections. We can't look at this as a stat that is erroneous, because we as municipal leaders, we're here basing our own life experiences, our beliefs, and our opinions on what we think is the right thing to do. There's conflicting data out there. I could very easily compare two random case trials such as Sweden or Quebec against each other, who had completely different strategies to deal with the COVID-19 pandemic. Sweden and Quebec, despite being completely different in how they dealt with things, one locking down, one not, one only allowing one member out into your front yard for about a week during the pandemic in Quebec. Their death stats are pretty much similar. Because of the lower population in Quebec compared to Sweden, the death rate for people in Quebec is actually 150 people more per million than they are in Sweden. So these are eye-raising stats that I have to look at and that we have to at least be aware of. I wonder why, when we started out the pandemic, that face masking wasn't at the top of the list of things that we could do as a preventative measure to flatten the curve, as we're here to say. I'm a big believer that that we don't need to enact punitive bylaws on our businesses and our individuals by not following along. That is shaking a big stick at someone isn't a way to build community, in my opinion. I grew up in a society where when you walked into a store, a lot of times it said no shirt, no shoes, no service. If a business chooses to say no shirt, no shoes, no mask, no service, I'm okay with that, and I will put on a mask. I wear a mask as well, as Councillor Brescia has stated, by choice in areas that I have to go and areas that request me to do it in. I'm not here to jump the gun and say I'm going to be afraid of something. I think we spend a lot of time and a lot of money being afraid. I want to build community and I want to promote love. Again, I'm going to point you to the stat of High River, 921, and they did not enact an enhanced status. That could go against my stance here right now, but like I said before, after 6 months of preparation, Alberta Health and Alberta Health Services should have at least figured out a number as to what would trigger an enhanced status. And for that, I'm totally on board with Councillor Brescia and where I think Councillor Clayton is going with this. If we don't enact a mandatory face mask policy, and we do get to a point where public health decides that they are going to use the powers that we have bestowed upon them, then we will have enhanced status, and then we can start face masking. But until that point, until public health makes a decree during this pandemic, I don't know if I can support any number, and it's for a mandatory face masking policy. I just don't think it is our role as professional opinionists to take that, all the stats that we can collect and that contradict each other to make a decision, when the true authority, as Councillor Brescia said countlessly, is public health, and Alberta Health should be laying down these mandates as they've laid down the mandates in our lives over the past 6 months. So, I mean, I guess I could keep talking about it for hours, but I'm going to end with that. Thank you very much.
Okay, thanks, Councillor Friesen. I see Councillor Blackburn.
Thank you, Mayor Given, and I appreciate the opportunity to speak a third time, but new considerations keep popping up. I wanted to push back a little bit on what Councillor Friesen is saying about what has happened to the numbers in Edmonton since masking was mandated. What we've heard from Dr. Hinshaw, at least what I understand, is that the increase in numbers is not because of the general spread or transmission through the general population. It has a lot to do with family and other social gatherings and specific outbreaks at specific locations that have brought the numbers up. That being the case, I don't think that the increase in numbers is an argument against the effectiveness of masking. I'll leave that with you, but I don't think it's fair to use those numbers in isolation without knowing something about them. Thank you.
Thanks, Councillor Blackburn. I don't think I had anybody else in the queue. I do feel compelled. High River has been raised as a case a couple of times about why the province didn't trigger enhanced status there. The information that I have is that the High River outbreak was in late April, early May. The province didn't actually enter stage 1 of their relaunch until mid-May, and so there wasn't an enhanced or a watch status to give High River in April or May, and so sort of equating it there is a bit of a challenge to suggest the province didn't choose to do it back then, even when cases were so high in High River, because the province didn't have that system in place to be able to require require an enhanced status. It certainly did trigger a lot of other things in the community, but there was no enhanced watch status like we have now under the province's relaunch strategy, which launched subsequent to the High River outbreak. Councillor Friesen?
Yeah, thank you, Mayor Given. I would just push back a little bit to that. Because of High River and because of the high-profile nature of it being the largest COVID-19 outbreak in our entire country, I would assume that the province of Alberta would have set their baselines based off of the High River. And I find it quite odd and confusing that even as of August 11th, when their council came to vote, despite the outbreak, that they still said no to face masks. So I'll just leave it there.
Thanks, Councillor Friesen. So I don't see anybody else with a comment, so we'll go to Councillor Friesen to close on her amendment to second reading. Councillor Friesen.
Thank you, Mayor Given. My colleagues certainly have given a lot of food for thought, and with it, I still encourage my colleagues to support this amendment. Our community has asked us for to set a point at which we will consider mandating masks. There are many that would like us to make that right away, and I, like many of my colleagues, I have a great deal of faith in Grande Prairie. We have been able to adjust our behaviors in the way that best suits us, including distancing, including, reducing our movements throughout the community, those sorts of things. And we will continue to do so. And I suspect that we may never get to this count because we are such a caring and concerned community that does adjust our behaviors. Time and again, we have seen that as our case counts start to climb, people reduce their movements, they pay more attention to social distancing, and more people start to wear masks. That's that voluntary use of masks, which I want to remind us has actually been a recommendation since the start of this, that when people are in close proximity to others, masks should be worn, and that is a source control face covering. So it's not like this is a new thing that we're also throwing in. This has been the recommendation since the beginning. The reason why we weren't all excited about mandating masks initially, if I can remind you, we were largely shut down. And now as we are relaunching, we're getting back together in spaces. And as we do so, it becomes increasingly difficult to maintain physical distancing. If, as I suspect, we never get to this point, I think that would be the most wonderful thing in the world. But I challenge you to say that you're not going to think once if, despite all our best efforts to keep our numbers down, it fails, and now we are seeing increasing numbers in the community. I appreciate Councillor Clayton saying, well, we can declare a state of local emergency, but boy, oh boy, if we don't, if we think that a mask mandate is an overreach, and that's a very simple thing, a state of local emergency with extraordinary authority is much more of an overreach, in my opinion. And I think, again, the community has been asking us to please settle this. They appreciate, we've heard time and again through the emails that they have appreciated that there is a firm number to look to, and behaviors can be adjusted up until we hit that, and even after we hit that number. But should our voluntary behaviors, voluntary adjustments to behavior fail, then this is a fairly simple response. And I suggest that we should do that at the initial recommendation of our administration, which is at the watch status. Thank you.
Okay, thanks, Councillor Friesen. So we will call for the vote on Councillor Friesen's amendment, and which, just to clarify, and Councillor Friesen, sorry, I'm not trying to contradict you, but was slightly different from the administration recommendation originally, in that I believe your amendment is a rate of a combined active case count equal to 50 cases per 100 across the city and county, rather than either or. And so it means that this could not be triggered by a small number of cases in the county, a relatively small sort of numerical number of cases in the county getting above that rate, and throwing the city into the requirement to have masks. This is a regional approach that looks at that rate of cases across the entire region. So I just want to make sure that everybody's clear that it isn't exactly as administration's original recommendation.
Yes, thank you, Mayor Given, that's right. I believe I said that's closer to that original recommendation of watch status. Thank you for that clarification.
Thank you. Okay, so if we're all clear, that's Councillor Friesen's amendment to second reading. So we will call for the vote on the amendment as proposed. All those in favor? Let's see, 1, 2, 3 in favor. I see myself, Councillor Friesen, and Councillor Blackburn in favor, and opposed. And I see the balance of my council colleagues in opposition, Councillors Bressie, Thiessen, Palat, O'Toole, Clayton, and Menhas opposed, so that amendment does not carry. We are on to second reading as proposed today, which has the recognizes, I mean, the section that we're really talking about here, and I see you, Councillor Blackburn, is section 4.1a, which now we're discussing debating a consolidated case count with a total number of 100 cases between the city and county of Grande Prairie. So that's in essence, that's the point that we're on right now, and what we're discussing and debating. Councillor Blackburn.
Thank you, Mayor Given. I do have another amendment for us to consider, and I'd appreciate Council's indulgence. I will offer the amendment and then speak to it. Amend paragraph 5 by adding at the end of the paragraph the words, "and keeping distances of 2 meters or more are difficult or not likely to be possible," and appropriate changes to the wording in the signage in Appendix B. Now, speaking to this, I have a feeling that a lot of what people object to when it comes to masking is they're going to be wearing masks in places where they feel that there is no need. For instance, if you go into a large store and you're one of a few people there and you're not going to be close to anybody, then why should I be wearing a mask? And I can accept that that would be top of mind for a lot of people. So maybe the situation that would be more acceptable for people is that if you're in a place where you can't keep those distances and it's either impossible or not likely that you would be able to keep those distances, then that's when masking would be appropriate. As per our original thoughts that wearing a mask has a way of preventing the droplets from passing on to other people who are close by. Another thing I'll say about the concept is that Councillor Bressie had commented that, masking appears from the wording that we've been hearing from many sources to be the third and last resort, maybe even more than third, but the last resort when social distancing and hand washing can't be maintained. I'd like to suggest that in a small contained space, such as the aisles inside a grocery store or inside one of our small shops that's only as wide as a single aisle, masking becomes the first line of defense because no amount of hand washing and no ability to socially distance is going to allow anybody to be protected from a possible infection by somebody else. Washing your hands or sanitizing them isn't going to stop the effects of droplets or aerosols in the air. So there are times when I really do believe that masking is the #1 barrier to infection. So I would like to propose that this amendment might be a reasonable compromise for those people who might feel that they are otherwise wearing masks needlessly. Thank you.
Okay, thanks, Councillor Blackburn. And so the intent was to add some additional terminology around item number 5, prohibition, which specifies that the requirement is for when that 2 meters of physical separation cannot be maintained. Is that a fair?
Is unlikely to be or difficult to maintain, yes.
Okay, thanks, Councillor Blackburn. Okay, and I'll just check with administration. City Manager, are you able to understand that the intent of that motion and the wording?
Thank you, Mr. Mayor. Yes, it is clear for me.
Okay, thank you. And so
I can email the wording if necessary.
Yeah,
sure. And then so council members, are we clear? I see. Yeah. Okay. So I see a number of council members that are not clear on the intent. Councillor Blackburn, do you want to restate? So we can all have prohibition point number 5 in the bylaw in front of us, and Councillor Blackburn, just state very specifically what you're proposing to amend there.
Sure. Right at the end of the paragraph, I would add a comma, and keeping distances of 2 meters or more are difficult or not likely to be possible. And then I also added the concept of changing the wording of the signage in Appendix B to match.
Okay.
So the intent is only to have to put on a mask if you're not going to be able to social distance inside a public place.
Okay. Thanks, Councillor Blackburn. I see Councillor Palat, then Councillor Clayton. And then I'll jump in after Councillor Clayton. Councillor Palat.
Thanks, Mayor Given. I really appreciate the intent. The problem I'm having is I think it kind of muddies it down. So I go into a store and I'm 7 feet apart from somebody, and then somebody pops out, and now I'm 5 feet, and now I got to pop out a mask. So I think the intentions are. I think this would actually be a very confusing thing to police and manage, and just I think we got to figure out a bylaw that's consistent. And I really do appreciate the intention, because I think it's very, very good. I think that it would definitely help when there's those scenarios. But saying that, I haven't been in a public scenario yet where there hasn't been ability to have proper social distancing, and businesses are being inspected constantly to make sure that it's happening. So I just think that would be very conflicting, and I think it would cause a lot more hardships with this. So I can't support it. Sorry, Councillor Blackburn. I appreciate your intention, though.
Okay, thanks, Councillor Palat. Councillor Clayton.
Thanks. I'll pass. Those were my comments. Thanks.
Okay. Yeah, and I'll just say the same thing. I also won't support the amendment because of the practicality of enforcement. In this kind of situation, we need to have a clear mandate that is easy for the public to understand, and the idea of, well, when you can't, and I can just imagine that somebody would reasonably be able to say, well, I was able to maintain 2 meters of distancing, even though they might have been standing over somebody's shoulder. And so it's sort of like saying, well, drive 50 kilometers an hour, except for when you think you can go faster. Well, I thought I could go faster, so I thought it was okay. So yeah, I think it is just too not clearly enough defined, and would leave a real subjective nature to determining whether or not it would have been possible to maintain 2 meter separation in that instance. So I also won't be able to support the motion. Do I see anybody else to speak to it? Councillor O'Toole?
Yeah, thank you very much, Mayor Given. Over the last couple of weeks, a couple of months, the people that were most concerned with this face bylaw were business owners. And the fact that if there's something put in there and they don't meet it, they can be shut down. There were some stores in town that were shut down temporarily because they weren't following processes. And I think, Mr. Blackburn, what you're suggesting could put a lot of business in a pickle if somebody was to be there and didn't have a face mask on when we weren't following the process because somebody got in between them. So like stated by the other councillors, this would be a very, very difficult item to kind of guard against. So I'm not supportive of this.
Thanks, Councillor O'Toole. I don't see anybody else with their hands up in the council chambers. And if that's the case, then I'll go back to Councillor Blackburn to close. And we may be in one of those situations where our internet, so I see that Councillor Blackburn's internet has paused. It always seems like it's in the evening hours when everybody's home from work and the kids are home and Netflix gets turned on. So I joke a bit. I think I appreciate everybody who wants to be as fair as possible. I see Councillor Blackburn is back, I think. Councillor Blackburn, are you there? Perhaps not. So we'll just maybe take a pause to allow Councillor Blackburn to close or at least vote on his motion. Councillor Blackburn, are you able to go just by audio?
My apologies, my internet connection. No, I don't think so. And so having heard none of the debate, I will not attempt to close. I'm sure that everybody has their opinion and it's not going to change by anything that I might have to say now. So please go ahead with the vote.
Okay, thanks, Councillor Blackburn. Apologize that you weren't able to capture that. So I will call for the vote on Councillor Blackburn's proposed amendment. Those in favor? I see Councillor Blackburn in favor and opposed. And I see the balance of my council colleagues in opposition. Myself, Councillor Friesen, Councillor Bressie, Councillor Thiessen, Councillor Plott, Councillor O'Toole, Councillor Clayton, and Councillor Minhas. So that motion does not carry. We're back to second reading as we started off today on Councillor O'Toole's motion for second reading. Is there any other discussion or debate on second reading? Seeing, yeah. Well, I will say, well, council members are deciding who wants to go first. I mean, you can put up your hands and I could call on you and let me make that decision. But since you didn't take that opportunity, I'm going to say that I would encourage council members to support second reading because, as we heard from the city manager, defeat of second reading means that we do not have an ability to bring the bylaw back. And I believe it's important that we have this tool available to us. The numbers it stands now in the bylaw is that 100 cases or enhanced status, both of which are a pretty high bar. Both of which I think we heard from members of our public who wished that we had a bylaw now or a week ago or a month ago. It won't meet their desires. And at the same time, having any bylaw won't meet somebody else's desires. Having a bylaw that is responsive to local conditions, I think, is a reasonable approach. And I don't believe it's overreaching. The other thing that I think is important that we all acknowledge that if the bylaw passes today, there is no requirement for anybody to do anything tomorrow or the next day or the next day until we reach that 100 cases combined between the city and county. That is a very reasonable bar. And for the members of the public that think council making a decision today has an impact on their life tomorrow, that is absolutely not the case. The final thing I would reference is that, you know, we have been comparing ourselves to other cities across the province, and many, not all, but many of the mid-sized cities are moving forward with similar bylaws, particularly in ones closer to larger centers. In others, Red Deer has been referenced in the past as a place that doesn't have a bylaw yet. What Red Deer has done is they chose to postpone third reading of their bylaw, which would respond to watch status, so a lower bar than us, than we're proposing here. But what they did is they did 2 readings and they postponed third reading, basically meaning that if and when they needed it, they would have that third reading right away. That is basically the same effect of what we would be doing tonight by passing the bylaw, and then when we hit that trigger point coming in. In fact, we would actually be slower than Red Deer because Red Deer is using watch status as their trigger, which we're above watch status. So for all those reasons, and you know, now that I've taken my time because I didn't say the hands. That's all I'll say on second reading. I would encourage council members to support second reading as proposed. And then I see Councillor Friesen and then Councillor Bressie.
Yeah, thank you very much, Mayor Given. You just stole my thunder. I was trying to decide if I wanted to do this now or postpone at third reading because I followed the Red Deer case very closely. And I was actually the councillor that brought it up at our last council meeting because I found it interesting that they wouldn't do it, but they would also postpone until they got to that point. I'm still on the fence about whether or not I even want to pass this bylaw, but in light of knowing that if we make a decision to just cancel and kill this right now on second reading, that we would lose any and all ability to even entertain the discussion for another 6 months. I'm totally okay at this point with passing second reading. So that's all I was going to say. Thanks, Bill.
Councillor Friesen, Councillor Bressie.
Great. Thank you, Mayor Given. There's two amendments I'd love to see this, and one is the enhanced trigger. That being said, my habit is I made that motion at committee and I got defeated at committee, and so I'm not going to make a motion that I've already made and been defeated on, but if somebody else did make that motion, I would certainly support it. However, the motion I do want to make is in relation to the sunset clause of this. Administration definitely did what we directed them to, but we directed to put a sunset clause of January 2021, and I know that this draft got, the sunset clause was January 1st, and I would move that Council amend the bylaw to change the sunset clause to January 31st, 2021. And just to speak to this a little bit, I know that will be disappointing for some who are watching this and think that this should expire as fast as possible. But two reasons why I think that's important is, number one, if we're going to take an evidence-based revision to this, then it probably makes sense to wait till the holiday season checks out and we've got some data to see how the holiday season went. And the other reason is I really think that there's substantial public attention to this, as we've seen. I know there's substantial public attention to this. I know there'll be substantial public attention to this whenever it comes back to council. I also think that in November, we're going to be discussing a very important budget. And I hope that there's lots of public attention to what we're doing with their money. And I really worry that if this is the conversation in November, then the public loses a lot of its ability and bandwidth to hold us accountable to the way we're spending their money. And so if this is January 1st date, budget, looking at my calendar, budget best case scenario probably passes November 16th. I think by that time, we're probably getting a little bit late to be crafting revisions to this. So I hope that council will support changing the sunset clause to January 31st.
Okay, thanks, Councillor Bressie. So that's a proposed amendment to change that sunset clause to January 31st, 2021. Okay, so open for discussion, debate on that motion. Councillor Palat.
Thank you, Mayor Given. I really like this amendment and I like the timing of it. I think, a lot of the things that I guess are bothering me with what's going on is I feel like governments still need to go on and do their business, and budget's a big part of what we do, and we need to put effort into that, and we need the community to be aware of that. And although this pandemic's important, we also have to show the community that we're diligent on making sure the city's operating. So I like the motion. I think it's great. We will have more data, more analytics after that. January 1 originally was for me was I wanted earlier, but earlier would be right in that October, November, and I don't think by then we're going to know enough about this. So I hope we all support this motion. I think it's a good one.
Thanks, Councillor Palat. Any other discussion or debate? Councillor O'Toole.
I fully support this. I think between the Christmas season, if there's any outbreaks, that'll give us enough time to understand where it's going, whether it's reduced or it's going higher. So yes, I fully support this. Thank you.
Thanks, Councillor O'Toole. Any other discussion or debate before I go to Councillor Bressie to close? Seeing none, and Councillor Bressie sort of waving that he doesn't need to close. Thanks, Councillor Bressie. Then, that being the case, we'll call for the vote on Councillor Bressie's amendment to reflect the sunset clause, point number 13 in the bylaw, that the bylaw will be in effect until January 31st, 2021. I will call for the vote. All those in favor? And I see that motion carries unanimously. All members on Zoom and all members in the council chambers, including myself, were in favor of that. So we're back on to second reading as amended just then. Councillor Friesen.
Thank you very much, Mayor Given. I'm going to propose an amendment as well, and this is again going back to August 31st and the proposal that Councillor Bressie made, probably even farther back at committee as well. And I would move that that the City of Grande Prairie implement a mandatory masking policy when our status level reaches enhanced. Now, I'm going to speak to this motion very quickly because first and foremost. The use of masks, to me, I think, at least now we've got it.
Sorry, Councillor Friesen, I just need to break in to clarify your intent, because as the bylaw is in front of us today, Section 4.1b reflects that enhanced status is also a way that would trigger a bylaw. So right now, as it is in front of us, it's either the total 100 cases or enhanced status, so it's actually 2.
Well, then I would just move to remove A.
Okay, so that, so let's be specific about what, so you're actually choosing to remove the 100 case threshold.
Yeah, and I'll speak to that too.
Okay.
I was actually quite happy that we raised the limit. Again, the arbitrary numbers, I think we're talking about minimums and we're talking about maximums, but I'm with Councillor Bressie in the fact that I think masking is an enhanced status for us, or an enhanced action that we could do when we've used out all of our other options. You can't really confuse me for someone in this community who doesn't care about people, so I hope nobody takes it this way. What I do see in our community that is creating a lot of division and a lot of confusion and a lot of angst, and the reason why we're talking about mandating masks here today is because quite frankly, people are offended on one side or the other. And you know what? I've heard lots of terms called out there. I don't want to put anybody into a panic or into a tizzy, but I think this gives us an opportunity. If we pass a bylaw that says enhanced status, we can actually turn around and propose to the province of Alberta to define what enhanced status means for us. That would be a letter from the mayor as voted on by council, and it would give us an opportunity to put Alberta Health and Alberta Health Services feet to the fire as far as defining this for not just our municipality, but for municipalities across the province. Now, Edmonton and Calgary have done something totally different. They don't have a trigger. They're just doing it, and when they want to lift the face mask mandatory policy, they can. I'm saying let's go the other way for this. And quite frankly, the reason why I'm proposing this is because I'm tired of people in our community, in our province, and in our country being afraid on one side or another. We have put in lots of money. I've just a rough estimate, about $5 trillion across Canada we have spent of both public and private dollars to fight something that we fear. This is from CERB to plexiglass to vaccines to business employee programs to school enhancement programs to sanitizers to temperature checks that are electronic at doors to mandatory face masks to floor stickers, social distancing, and electronic doors at various store locations. I think we have gone above and beyond in trying to combat this virus, which is questionable in some cases as to how deadly this is, how much it actually justifies itself in being a pandemic. And I don't have a lot of confidence when public health sets three rates, and one being watch, and they can define watch, but they can't define enhanced status. So for all these reasons, and also for the impractical use of masking, as well as numerous accounts of how face masks have not helped curb the spread of COVID in not just cities like Edmonton, Calgary, and Montreal, but also in other places around the world, such as Spain. And there are other examples out there. I'm not going to list them off. So for all those reasons, I think it is our duty to serve our people, to ask for those answers from our province. And for all those reasons, I would move that I hope I move you enough to vote in favor of this, because we didn't have it on August 31st. So that will be my motion. And I guess this is my close. So enhanced status, let's eliminate A, and I hope to hear a good round chorus of debate here.
Okay, thanks, Councillor Friesen. So that motion is open for discussion and debate. Again, the effect of the motion would be to remove 4.1A, which would leave the only triggering factor being a relaunch status of either municipality to enhanced as per the Government of Alberta. Okay, open discussion on that point. I see Councillor Blackburn may wish to get into debate, and Councillor Blackburn, if your internet is, bandwidth is providing some challenges, you may want to go to just audio rather than video, and certainly let us know if you're able to do that. I will say, I will enter the debate to say that I would not support the motion. This appears to have the same effect of having, I won't say no bylaw, but pretty darn close when no municipality in the province has hit that status. I'm not looking to try to find a trigger that we can trigger immediately. I think the 100 cases per 100,000, our total of 100 cases for the city and county is actually a pretty high bar. I think that's a reasonable approach. The enhanced status is completely undefined and doesn't even give our community something to work towards. At least with a number, our community is able to say, hey, I can see where we're going, I can see the trend, and I think we need to do something about that, so I'm going to control my behaviors, I'm going to change them. If we wait for enhanced status, which is undefined by the province, and I think not likely to be defined, we don't give our community the same ability to have an impact on the status of this. So for those reasons, I won't be able to support the proposed amendment. I would encourage council to defeat the proposed amendment, recognizing that we do have enhanced status as an additional triggering option in the bylaw today, if there was some reason the province felt that they needed to trigger that. I think I saw Councillor O'Toole.
Yes, thank you very much, Mayor Given. I won't be supporting this. I do truly believe that when you have a number and we hear media reports or whoever's giving the reports, whether it's the city or Alberta Health Services, and we're coming closer to that number, I think people will act a little differently when there's no actual number. It's just a position which we've said we would take. And I truly believe that the number is what we need to look at. So that's my 2 cents, and thank you.
Thanks, Councillor O'Toole. I see now Councillor Minhas, Councillor Friesen, Councillor Bressie. Councillor Minhas.
Thank you, Mayor. I can't support this one either because we already passed the thing to January 31st, 21. So that'll tell us the results. But this don't make sense to me to keep amending the promotion and removing it. Sorry, so I can't support this one either.
Okay, thanks, Councillor Minhas. Councillor Friesen and Councillor Bressie.
Thank you, Mayor Given. I'm not going to lie, I have considered this at different points in the last few weeks, but I really see this as an abdication of responsibility. Our residents have asked us to make a decision, and they have asked us for a point at which we will mandate masks. If we're going to put that point at a place that is so high that we are confident it will never happen, we might as well not set a trigger at all. So I will not support enhanced status. And, you know, it's a lofty goal to think that perhaps we could get a really precise definition of what enhanced is, but there are so many qualitative considerations that go into it that all have interplay, and we will not get that. Just one more thing that I want to, I do enjoy that Councillor Friesen likes throwing out numbers, and I'm going to put one out here. So the death rate for influenza and pneumonia, all influenzas and pneumonia combined in Canada, 2000 to 2018, the highest year rate of death was 2018. That is from all influenzas and pneumonia combined. I'm on statista.com here. So in 2018, 23 people per 100,000 died of influenzas and pneumonias, and that is over the year of 2018. Over the course of time since we have started to see COVID deaths in Canada, we have exceeded the 2018 number. We are now, and I think we hit this several days ago, we're at 24 deaths per 100,000. So if we have exceeded in COVID deaths to date the entire years worth of deaths from all influenzas combined, I think that to abdicate our responsibility and suggest that we don't begin to, at some point, consider enforcement of masks, to let more people die from COVID than all influenzas combined for want of a mask, I think is highly irresponsible of us. So I will not support the amendment.
Thanks, Councillor Friesen. Councillor Bressie is next in the queue. I just want to check in with Councillor Blackburn. He messaged me to say that he's going to turn off his video. Councillor Blackburn, turn on your audio just to see if you can, if we can hear you.
Yes, I hope you can hear me.
Yes, Councillor Blackburn, we can hear you. So just to preserve bandwidth on Councillor Blackburn's end, we'll ask him to turn off his video. And Councillor Blackburn, if and when we get to a vote, I'll sort of call on you verbally to give us your vote verbally. And I will make sure that I give you an opportunity to participate in the debate by calling on you specifically. Councillor Bressie.
Thank you.
Great. Thank you, Mayor Given. I want to push back on a few things I heard. And one is that if this motion passes, we don't have a number to work towards. We still do. We have that watch number. And the way that I see that watch status is that is a good indication to the community of, oh, the medical experts are getting more involved in our community. They're watching more closely. So let's make sure that they like what they see and they don't have a reason, both quantitative and those very real qualitative reasons that exist to go to the next level, because we're getting this under control with our voluntary measures. So I think we do have that number. We've got that watch status number. I heard it said that passing this amendment is an abdication of our responsibility, and I 100% disagree with that. I think that what this is saying that we see our responsibility to work with the province and to work with their medical experts. That's the approach we've taken all along throughout our COVID-19 response. The city hasn't gone in and instituted a whole bunch of restrictions on its own. We've sent business ambassadors into businesses and given coaching and helped them understand provincial guidelines and given them ideas on how they could better pursue public health in their businesses. But we haven't instituted a bunch of restrictions on our own. All along, we have been saying we trust Alberta Health and we trust the medical officers of health, and we will support them. What's changed in our community? Our community has done a good job throughout this pandemic. I'm really proud of our residents. I'm really proud of our businesses. We've done a good job through this pandemic. What's changing all of a sudden for us to say we don't trust the medical experts, the medical officers of health, to know when our community needs enhanced restrictions in it anymore? I really do think that when I hear somebody say, well, hey, enhanced status is never going to be declared, what I hear there is I don't trust our medical officers of health to give the advice they should be giving to local officials and to provincial officials. And I don't trust them to do their job. And if that's your position, fair enough. But let's just acknowledge that that is what we're discussing right now. And I think for me, I do trust our medical experts who have way more experience, way more education, and maybe most importantly, way more access to actual data than we have to tell us when enhanced measures are needed. So I'd encourage council to support this amendment because I trust our medical officers of health.
Thanks, Councillor Bressie. Councillor Plott.
Thank you, Mayor Given. I just have a question for administration. If this bylaw were to pass, or this amendment were to pass, we went to enhanced status, would council still have the ability, if we hit 100 or 200 cases, to be able to amend this bylaw and bring this back? And so my question is if we do trust Alberta Health Services and their lead on this and what they're saying, and enhanced is the way we go, I just would like to know that I still have the ability, if we want to bring back a number, that we could.
City Manager Galante.
Yeah. Okay. Thank you, Mr. Mayor. Yes, that is correct. If the bylaw is approved today and is enacted, then council can revisit this bylaw in the future with potential amendment.
Okay. Thank you for that, Horacio. I appreciate that because, right from the start, I think a lot of us have lost sleep over this. I know I certainly have. And the reason I'm losing sleep over it is I'm not a health professional. I want to do the right thing for the community. But I think we've also got to recognize this is one of the biggest downloads from Alberta Health Services in the province that we've seen. It's, you know, in 3 years of being on council, I haven't seen a major decision like this that impacts our community this much be dropped on our desks that has not our skill sets. This is Alberta Health Services ball to dribble, and they're just not. And so by going into enhanced, it actually puts the power where it should be. We're putting it back in the medical professions that actually understand it. The one thing about the 100 that does scare me a little bit, where the enhanced, if I'm understanding it, is it will look at where the cases came from. So if we had 100 outbreaks from one source versus different things, I think the enhanced gives us better analytics. So as much as I really want to give the community a number, I also want to remind our community that this shouldn't have been our responsibility. And I appreciate all the emails, and I apologize for not getting back to the 500-ish we've got. But I urge a lot of you to maybe remind Alberta Health Services that this is their ball to dribble, and this shouldn't have been ever dropped on our plate. And it really frustrates me that we're even dealing with this at council level. So I really would love the people that are frustrated about if this doesn't go forward to remind you that this is being downloaded, and this is something I feel as a councillor, we need to keep the levels of government above us accountable. And by not doing something like this, we're kind of not keeping them accountable. So I'm actually going to support this motion.
Thanks, Councillor Platt. I'll enter, and then I've got Councillor Clayton. You know, just in terms of responsibilities, different orders of government, I appreciate that argument, and we would need to consider applying that in a whole bunch of other facets of our community. Municipalities have no responsibility to provide anything with respect to homelessness. It's not a requirement in the Local Government Act. It's something that we do because our community demands it of us, and there's an expectation that we deal with it. And so, you know, and I think that there are a number of other examples of that, environmental programs, mowing lawn. You know, the community has expectations of us, whether or not there are direct responsibilities. And so I would agree it would be helpful if the province was more forthcoming with advice for municipalities. I will 100% agree with that. And, you know, I would remind council members that we have had that conversation with our MLAs, being very specific about saying, hey, it would be helpful to us if we had better guidance. We heard that that was a reasonable request, and I have not to date received anything, and I know that the province hasn't provided any additional guidance to municipalities. And finally, you know, my concern about enhanced status being the only one is I see that as having a significant amount of risk for our community. There is no suggestion that if the province declares us having reached enhanced status, whatever trigger that might be, that their solution to that would be masks. Their solution to that could be a lockdown or closure of businesses or curtailing of business. And I would rather do something that is somewhat preventative to try to prevent us from getting to an enhanced status. So if there is a step that we can take that could slow the spread and prevent us from getting to that enhanced status, which is obviously beyond a simple watch, I would rather take that step as a proactive measure. And I think that that is something we're elected to do. Take proactive steps to try as best we can with the information we have available to protect the safety of our community. And I think that removing a trigger point that is in a number fails on that measure. So for those reasons, I won't support the amendment. Okay, is there anybody else that wishes to speak on the amendment? Yeah, Councillor Platt.
Thanks, Mayor. Just some clarification. If this were to fail, we went back to the proposed bylaw, it says or. So wouldn't all the same things that you're concerned about with the relaunch for the enhanced strategy and the province stepping in, wouldn't those all be the same thing whether we had 100 or not? If I'm understanding the word or in this?
The bylaw does have both. The enhanced status appears to be quite a bit higher. There are municipalities that it would be, so at 100 cases per 100,000 population, which is sort of what the bylaw is right now, there are municipalities that are up at that, and they haven't hit enhanced status. I actually see enhanced status as in the second part of the bylaw here, as an opportunity if the province came in with some, as Councillor Friesen had said, qualitative reason, so quantitative being number of cases, qualitative being, hey, there's something going on that, you know, that we can't predict or we don't know why it's happening. And while the case numbers aren't necessarily that high, some other thing that's going on, then potentially they could throw us into enhanced status. We don't know that. But I think that having both approaches available makes a lot of sense. So the bylaw, in my opinion, Councillor Platt, is substantially different if the only measure is enhanced status as a trigger. I do see Councillor Blackburn wish to get into the queue, and then Councillor Clayton. Councillor Blackburn, if you'd like to turn on your mic.
Thank you, Mayor Given. Boy, this is hard. I was, when I first put my hand up, I was going to be in support of the amendment, start to get into trouble. We have as much ability to approach the government as the government has to approach us. And that if we were to work in lockstep with our local AHS authorities, we could call upon the government to help us decide what the right steps are to take. But then I heard your argument that says that if the government does step in and suggest the kinds of measures that we need to take, it would probably end up being things like lockdowns or shutdowns of some sort. And I know that early on in this debate, weeks ago, our councillors, many of them wanted to support local business and not put them in a situation like we were in when this pandemic all started. So I really am up in the air about this. My feeling is that we must pass the bylaw. And so if the only trigger that's going to make masks a part of it is to have that 100 in there, then I have to oppose the amendment, even though to some degree it makes some sense and it is something that we might be able to work with. Thank you. And I do apologize. I know I have no control over whether or not I'm going to be participating in a meaningful way here. It's kind of embarrassing, and I'm sorry to burden the council with it, but there's no way around it, and I do appreciate being able to fully participate.
Absolutely, Councillor Blackburn. Appreciate your sticking with us through that. We all have had the frustration of using technology over the last little while. Councillor Clayton.
Thanks, Mayor Given. You know, I've heard some great comments tonight, and for me, I agree that this is an unfortunate situation as municipal elected officials that we're put in making a decision that has such impact and on our residents, but as well, it truly is still a provincial decision, in my opinion. As much as we're not consulted on where we think the best use of our health dollars are spent within our own region, we're not being provided the information, as much information as we could be to make a good decision. That aside, I think the motion as it stands is absolutely best for our community at this time for a couple reasons. As the mayor stated, it gives us two options. It's either 100 cases or the enhanced status. And I was leaning towards the enhanced status because I think that will involve more input from AHS because it has to. And we've talked a few times tonight about what that 100 could represent. It could be 5 situations of 20 isolated cases that maybe don't justify the community being shut down, but it also could mean a really rapid growth of infections. So I think that having both the 100 and the enhanced status gives us sort of a cushion in regards to the province having the medical professionals that they need to say, yeah, that's not looking good. They need to step in. But it also gives our residents a comfort in knowing what the trigger point is. So I won't support the amendment, and I will support the motion as originally intended. Thank you.
Okay, thanks, Councillor Clayton. I see. I'll just check to see. I think we're back to Councillor Bressie to close, or no? Yeah, okay, Councillor Thiesen's motion. Thank you. So Councillor Bressie, and then we'll go to Councillor Thiesen to close.
Great, thank you. I just want to chime in about this municipal downloading. So it's something I've been very vocal and very public about, that I think that it is ridiculous that the download we've seen from provincial politicians I want to be really clear that that's not why I support this amendment. If they've downloaded to us, well, fine, we'll pick up the ball and we'll lead the community the way that we think we need to lead that we know is best to lead this community. For me, why I support this is because my understanding of the enhanced status is that that's not a political decision. My understanding is that enhanced status happens not when cabinet looks at a community, and I'm open to being corrected, but my understanding is enhanced status isn't cabinet looking at a community and saying things are getting out of control. My understanding is it's medical officers of health looking at a community and saying something's getting out of control, and then the politicians get to step in and say, all right, what are we going to do about that? And I don't have a high degree of trust in our provincial politicians in this after I've seen the download, but I do have a high degree of trust in our civil servants who are professionals, not politicians, to be monitoring the restrictions we do have in place and giving advice on when they feel that those restrictions need to be eased up or down. And so again, for me, it's trust of this process or you don't trust this process, and fair enough if you don't trust the enhanced process, but that's what I'm weighing, not is this a download or is this not a download.
Thanks, Councillor Rusty. Councillor Friesen to close.
Thank you very much. It's been a great round of debate, and I think I can add, but I'm still going to try to close and sway a few of you here. It's been said that it's an abdication of our responsibility to not make this decision. Well, I would push back and say that during a pandemic, it's an abdication of the province's and Alberta Health's responsibility to implement this mandatory face masking. In fact, I would say that by not even having a defined enhanced status per 100,000 by the province is the equivalent of doing about 2/3 of your homework and handing it in and expecting to get a good grade. I think over this time during coronavirus, we have seen a moving target that not one of us are really comfortable with or really aware of how it's going to go. We've seen models that have not gone through as we anticipated they might. We've seen death stats that were much lower. We've seen infection rates that were much higher, all in the modeling. And this did not come out and translate into a big, crucial death wave that was going through our province or even our community. This is fluid, and I think we should be fluid in our decision-making and our process. We should be ready to be nimble and quick. As the mayor said, the relaunch started in May. That's the truth. That has given Alberta Health Services in the province of Alberta 3 months, which is half the time of this pandemic, to build and to create data for what an enhanced level of healthcare, strategies is here for and what we're going to do. Fundamentally, I'm opposed to living in a constant state of fear. And fundamentally, I'd like to actually see where we could apply, as I stated earlier, $5 trillion across Canada, public and private dollars, into things that we love, into building the society we want to create, not running away from something that we are afraid of. It is the province's responsibility, especially during a pandemic, for them to lay out the numbers for us to make these decisions. And in fact, they should be making these decisions. And as leaders in our community, it is paramount to us for us to be able to at least call upon the province and ask them to show us the final results of what an enhanced status looks like. We can go with the 100 but as far as I'm concerned, 100 and 37 are both arbitrary numbers without that enhanced status. And that enhanced status, in fact, could be, in the context of Grande Prairie, lower than 100 people. But we don't know that because it is as yet undefined. So for all those reasons, I would urge Council to support this amendment as proposed to eliminate the A part, and we'll see how that turns out. Thanks.
Okay, thanks for that close, Councillor Friesen. So we will call for the vote on Councillor Thiesen's motion, and I will first. Trying to say, okay, Councillor Blackburn, I see you back on video, so I'm going to try it that way. I will call for the vote on Councillor Thiesen's motion. All those in favor? Okay, and I see 3 in favor, Councillor Friesen, Palat, and Bressie, and opposed. And opposed is the Balance of council, Councillor Blackburn, Minhas, Friesen, myself, Councillor Clayton, and Councillor O'Toole. Okay, so that motion does not carry. We're back to the bylaw as originally brought forward today on second reading. Open for one last round of discussion and debate on second reading. Councillor Palat.
Thank you, Mayor Given. As I stated earlier, this was the number that I felt like it wasn't where my appetite was, obviously, but I felt this was the balance line for our community. So I'm happy to support it. I do hope, though, that this doesn't create a false sense of security within our community. I really do hope that people continue to social distance. And when they're not wearing a mask, please have a smile when you're out in the community. Please show some empathy towards people. This has been one of the most divisive things in our community, and it saddens me daily of some of the animosity here people put towards each other. And to Councillor Thiesen's point, basically based on fear. And I really hope people continue to get educated, but continue to stay healthy. I mean, we're talking about masks today, but I love all the conversations and lots of the emails talking about get healthy, get your immune system up, get some exercise, get outdoors. And I wish we were having more campaigns around that in the province rather than just fear-based, everyday, in-your-face campaigns. So I hope we support this. I think our community deserves it. And I think for council, after lots of hours of deliberation on this previous, via emails and everything else, I think this is the right song for the community.
Thanks, Councillor Platt. Any other discussion or debate on second reading? I think I recognize Councillor Blackburn. Councillor Blackburn, you wish to get in on the main motion for second reading?
Yes, thank you very much, Mayor Given. A couple of points. First one to the concerns that people have about the fact that we are being downloaded with this decision. You're right, we are being downloaded with a decision, and it's a shame that it had to happen that way. But the fact of the matter is that it has been put in our lap. It wasn't too long ago that we were jumping through all kinds of hoops to prepare for the legalization of cannabis in our community, not because we had chosen to do that, but because it was put in our laps, and we dealt with it, I think, extremely effectively. So on the first hand, I would urge councillors to not oppose this by another level of government. The second point I'll make, and you've heard me say this before, I do believe that we're on the verge of a second wave, and it may be a very short amount of time before we reach that 100 mark. And so for that reason, I'm not too concerned about that mark being there. And we do need to have masks as part of the defense against this. I don't fear the I don't fear the virus itself. What I fear is people's reaction or lack of reaction to the possibility that the virus is going to hit us in a big way. So I would vote in favor, and I would encourage all council to vote in favor as well.
Okay, thank you
for the opportunity to speak.
Thank you, Councillor Blackburn. Any other discussion or debate? I'll just say that I agree with Councillor Plott. I think that this is perhaps not exactly where anybody in their, an idealized world would have chosen to land. I know for me, I would have preferred the watch status, which was slightly lower. But I actually will take the words of one of our delegations today. She's quite well spoken, I thought, particularly in this part, from her view that sooner is better than later, something is better than nothing. And really, I'm taking that approach here. So I'm comfortable with supporting the 100 number, and even though I might have been on the other side of saying, watch status, which would have been a lower number, would be better. I think this is a reasonable balance between the different views that we have heard expressed in the community, and certainly that we've had among our council members. So I appreciate everybody looking to come towards a more of a consensus number. I will see if there's anybody else that wishes to speak. Councillor Platt.
Thanks, Mayor Given. This is more of a question for administration. I guess if this bylaw were to pass, which I'm feeling it's probably going to pass now, I think we've got to a spot where we're all content with something. It's Tuesday and we hit 100 cases. How do I wake up Wednesday morning and know that I need to wear a mask? What's the process the city's going to take? How are we going to market this? How are we going to educate people? I'm just wondering what administration sees that rolling out like. And I guess what I would be fearful is somebody that doesn't plug in every day, which seems weird right now with what's going on, doesn't, and then they get publicly shamed for not wearing a mask. I just want to really make sure this is about education to me, and so I really want to make sure that people are aware of it. So if administration can let me know, please, how we're going to make sure the community knows this in a very timely fashion.
Okay, thank you. City Manager Galante.
Okay, thank you, Mr. Mayor. I will defer the details on the communications plan and the escalation in the event that bylaw is triggered to Director Burke. Shane has been working with his team to launch the initial phase of this public information campaign that could be increased and escalated using different media channels. But Shane, if you can expand a little bit on a potential trigger and the efforts your team is putting into this. Thank you.
Director Bork.
Thank you, Mayor Given. We have been working on a plan that, as the city manager indicated, that is really focused on education. So if this was triggered on day one, our voluntary mask campaign that is on billboards and social media would pivot to a different look mandatory mask campaign. We'd also be using something similar that we do for the snow removal in the winter, which gives a daily update saying it's a mask day or not mask day on the service update on our website. Residents can also sign up for a dedicated email that will go out as soon as that's updated every day. But really, it is building on the voluntary campaign with different messaging and focusing on education. And I would leave it to Director Manuel if there's anything further to add on enforcement plans.
Okay, thanks. Director Manuel, do you care to contribute there?
Okay, certainly from an enforcement perspective, we would take that educational approach very seriously, as compliance is what we're looking to achieve. We're not looking to punish anybody, and especially given the transitional phase that would be required to, like you said, notify the public of the changes. So I understand, I believe down in Calgary, they've only issued, I think, less than 5 tickets in the community of 1.2 million people. So I feel pretty confident in our approach to education there.
Okay, thanks, Director Manuel, and Director Bork, and City Manager Galante for that answer. So I don't see anybody else with any questions or comments, so I will call for the vote on second reading as amended. And I'll just remind Council, there was, after all that discussion, there was one amendment that was passed this evening. That was to extend the sunset clause date to January 31st of 2021. So that one was made and carried. And so we are passing the bylaw, being asked to vote on the bylaw as it is in our package with that one amendment. So I will call for the vote. All those in favor? Okay. And I see in favor myself, Councillor Friesen, Councillor Bressy, Councillor Thiessen, Councillor Platt, Councillor O'Toole, Councillor Clayton, Councillor Blackburn, and Councillor Minhas. So that motion does carry unanimously. So I would look for a motion for third reading. Councillor O'Toole.
Whew. Okay. I move that Council gives third reading to bylaw C-1426, being the temporary mandatory face covering mask bylaw.
Okay, thanks very much, Councillor O'Toole. Open for discussion debate on third reading. Councillor Thiessen.
I was wondering if it might be appropriate, since I had a different motion for third reading, if I may, to postpone third reading would be my motion.
So Councillor O'Toole is making the motion for third reading. You're making a motion to postpone third reading. In terms of precedence, I just have to check and see which motion takes precedence over the other, and I would just look to the city clerk to confirm for me which of those would take precedence. Can Councillor Friesen make a motion to postpone on top of Councillor O'Toole's motion to pass third reading?
Thank you, Mayor Given. There is, that is correct. There is some clarification required on Councillor Friesen's motion. Their possibilities are dependent on what his intent is. If his motion is to postpone indefinitely, that effectively kills the bylaw, and then there is no further action. If it's to postpone to a specific date and time, then that motion is in order. It can be amended and it can be debated.
Sure, but just for clarity, Councillor O'Toole did make the motion for third reading. So is his motion set aside for Councillor Friesen's desire to make a motion to postpone?
That is correct.
Okay. So Councillor Friesen, you have put forward a motion to postpone. Go ahead and speak to it.
I sure will. And I think I'm hoping that this will sort of sit well with all of council in this, because I've heard lots of talk about wanting to be at watch status or enhanced. So my motion would be that council postpone third reading until we reach watch status in the city or county of Grande Prairie. And the reason why I put that there is because there is a bit of public education that I just heard that we wanted to, inform the public about. Obviously, this is an attention-grabbing bylaw, and there is some sentiment in our community to, or at least around the council table, to look at the watch status as that 37 or that 16, that could be that potential. Now, I know the bylaw says 100, but I think it would be appropriate to maybe have that discussion and introduce it earlier rather than pass this bylaw and go, oh, we're at 100 right now. I think by postponing till third reading, to give third reading until we hit watch status actually gives the community that extra leg up from that 37 or 16 cases in the city or county before we get to that 100. So it gives our administration plenty of time to advertise to the community that, hey, we're on watch right now, and we could get to that 100, and we may be mandating face masks through this policy. I think it would be just a great way, number one, first and foremost, not to kill this bill, but at the same time to give our administration a heads up and to keep the community talking about this as we go forward. So I hope you will support it.
Okay, thanks, Councillor Friesen. I see Councillor Clayton.
Thanks, Mayor Given. I guess my question is for CAO Galante. From my understanding, when we get to watch status, we can simply advise the community we're at watch status. I don't know why we would want to postpone the reading. I mean, the simple messaging in regards to, okay, we're at 50 cases per 100,000, let's be on watch. And so to postpone it tonight, our residents want us to make a decision. And so at this point, we have a decision in front of us that we've agreed to on second reading. If you simply want to delay it by 2 weeks and don't have third reading, that's your right. But I think people want us to make a decision. They want to move on. And I know I want to move on, regardless if it's an ideal situation and a decision of where everybody wanted to be. We need to move on. And the watch status will still stay there. Our communication department can continue to communicate when we get to watch status. I'm missing, I guess my question isn't for CAO Galante. My question is for you, Councillor Friesen. What's the difference? Like, we're already going to communicate that when we get to watch status.
Councillor Friesen, go ahead.
Yeah, that's actually a great question, and my answer to that is, honestly, when we pass a bylaw, when we move forward with this, a lot of people tune out. They really tune out. I can get the sense and the feeling that we all want to have some kind of bylaw here, and we all want to keep our community engaged. The purpose of it is as much as I hate the hundreds of emails that we got on one side or the other, some nice, some really educational, in fact, on both sides, that we keep this dialogue going, and not as a polarizing effect, but as in the account that if council's talking about it, the community's talking about it. If we're just sending out like advertisements saying, hey, this is happening, we're at watch status, are people really going to be paying attention to it? Now, if people think that there's a decision to be made, maybe there's an opportunity there to educate on one side or the other, especially for the, I guess, the more caustic of people who are coming forward. So this isn't a matter of delaying it to cancel it at all. In fact, I see the writings on the wall. We're going to pass this bylaw, and I'm okay with that. I'm okay with the numbers, but to keep it into the public arena while we're going through this would be great. I'd also follow up probably with a follow-up motion that we ask the province, we direct the mayor to write a letter to the province to define enhanced status for us and other communities per 100,000. But for right now, I think when we deal with it, we get it done, it'll be news for a week, and then it won't be news again until we hit 100, or at least as far as like on the lips of people.
Thanks, Councillor Thiessen. I've got Councillor O'Toole, Councillor Bressy, Councillor Plott, and then Councillor Clayton if you want to come back in. Councillor O'Toole.
Thank you, Mayor Given. I definitely won't be supporting this. I think our administration has been giving us a lot of information to digest. They've been in constant communication with the province. We had a number of things enacted. We had daily updates, sometimes twice a day. And this has been the top news story on national news since February, COVID-19. It's affecting the entire world. I don't think that we pass this tonight or we delay it tonight, that they're not going to be talking about it tomorrow and it's not going to end on Wednesday or Thursday or Friday of next week. This is something that's in everybody's face every day. And by delaying it, it's just going to cause more disgruntled people that they think that this council is not doing their job. And I think if we make the decision today, it'll put some comfort into people in this community and the region that we are capable of making a serious decision. And with that, I thank you.
Thanks, Councillor O'Toole, Councillor Bressy, then Councillor Plott, and then Councillor Blackburn I'm going to go to. Wanted to get in the queue.
Thank you, Mayor Given. Yeah, I appreciate the intent, and maybe even from a governance perspective, in pure vacuum, it might be good to have an automatic, all right, when we hit watch, we're reevaluating this. But I think from a leadership perspective, I just can't support this for a few reasons. One is I really am worried about fatigue over COVID-19. And I've shared that I really am worried that this conversation around masks have sucked so much air out of the room that we really are at risk of losing ground on social distancing and hand hygiene and staying home when we're symptomatic and those other measures that we know are more effective. And I'd like us to get back to talking about those other things. I really am worried about the division this creates in communities where I've heard stories of family members that aren't speaking to each other over masks. And that's profoundly disturbing to me. And I think that needs to end in our community. And that means us showing leadership by making a decision today. And also, I shared a little bit before about the accountability of other decisions council's making. Today, I'll note that we launched this mask issue is probably the most important decision maybe we'll make as a council. But today we launched an engagement survey on probably the second most important issue we'll decide as this whole council term. And that is, are we going to spend $55 million or not on Revolution Place, which could have some huge benefits for our community, but also will cost taxpayers a lot of money. It's a hugely important decision that I really hope we get vigorous public debate on. And I'm really worried that if the debate keeps on being around masks, again, we're not being accountable both to build a great city and also to be responsible with taxpayers' dollars. And so I really think that this motion, I understand the intent. And in a vacuum, from a just raw vacuum governance perspective, it would be nice in an ideal world. But I just think where we are as a community and as a council right now, we really do need to pass a bylaw tonight. Or not pass a bylaw tonight, but make a decision one way or the other.
Thanks, Councillor Bessie. Councillor Palat, and then Councillor Blackburn.
Thanks, Mayor Given. I really do appreciate we were trying to go with this, Councillor Friesen, but I can't support it as well. I agree with Councillor Bessie. I think the community needs a decision, and I think we need to put this to bed so that we can actually get on with business and other things that we should be. Not that this hasn't been important, but I really wish council was spending this much time and energy on some strategic things that we've had on our plate for a while, and this has kind of sidetracked us. So I'd like to get this done and move on so we can really get back to the business of council. I do want to encourage you though to, you talked about a potential other motion of to writing a letter to the province about enhanced status. If this doesn't go well for you, which I don't think it's gonna, I don't want you to not to throw that one out. Thanks.
Thanks, Councillor Platt. Councillor Blackburn, you are in the queue, and then Councillor Clayton.
Thank you, Mayor Given, and I see that Councillor Minhas has been putting his hand up as well. I'm not going to repeat what everybody has already said. I'm in agreement with most folks who are in opposition to this amendment, and I will leave it at that. Thank you.
Okay, thanks, Councillor Blackburn. Councillor Clayton, then Councillor Minhas.
Thanks, Mayor Given. I won't be long. Most of the comments had already been said, but Councillor Thiessen, you referenced the fact that this may sort of lose focus and priority in regards to what's top of people's mind. And I would encourage, if this motion isn't successful, maybe you put forward a motion in regards to a communication approach that keeps this discussion top of mind. I think it's everyone around the table's responsibility to remind our community when it's getting close to watch status. We already, if this motion passes at 100, the next step that is just as important, if not more important, is the watch status. So it's just as much as it's our responsibility as an organization and as elected officials. It's the people that you speak to every day to remind them. The watch status is a scary number as well. So once we get to that scary number of 50, hopefully we don't ever get there. But if we do, we need to be on high alert so that we don't get to that 100. So the people that are opposing masks, be very conscious of the fact that although tonight it appears that you may be given the go-ahead to not wear masks when you choose not to, you also need to be very cognizant of the people around you that are wearing masks. We need to be positive in our community, as mentioned earlier, but we also have to recognize that this number could change very quickly. And very quickly we could be at watch status, and then very quickly we could be at 100. So I think that it's really important for everyone around the table and everyone within our organization to remind people in our region what those numbers mean. So although I don't support your motion, I think that it's a very important discussion. Thanks.
Thanks, Councillor Clayton. Councillor Minhas.
Thank you, Mayor Given. There's a couple of reasons, like the watch status is 17 or 36. And that's what I'm supporting for this 100, because we were going 50 in support for it. The other thing I'm getting really concerned about it, because a lot of people send us the emails and they need to make us the decision and show the leadership. So that's what I don't support this one, because we can keep prolonging here, amending here all night. We're not going to get nowhere. We have to make the decision and show the public. There are some people in the favor to put the mask, other one they're not, but at least then they'll be satisfied, whatever the reason. If they like it or not, that's their choice. But we got to make the decision and move on to it. That's what I would say. And yeah.
Okay, thanks, Councillor Minhas. I don't think we have anybody else in the queue. Councillor Thiessen, do you wish to close? I'm seeing that he doesn't. So I'll call for the vote on Councillor Thiessen's motion to postpone. All in favor? I don't see anybody in favor, and all opposed. That motion carries unanimously. Sorry, that motion is defeated unanimously. All members of council, including Councillor Thiessen, have voted in opposition to that motion. We're back on to third reading as moved by Councillor O'Toole. Is there any other discussion or debate for third reading? As I check my screens and my people in the room, I don't see anybody raising their hands, so then I will call for the vote on third reading. All those in favor? Okay. And I see all members of council in favor. That motion carries unanimously. I think council members are relieved to be through that business, but we're not done our meeting. So that does deal with all of the items, all the business on item 13.1. Oh, sorry, Councillor Friesen, you had something additional?
Thank you. I defer to Eunice, but I was just going to make one more motion, and I would move that council direct the mayor to write a letter to Alberta Health and Alberta Health Services to request more of a definition surrounding enhanced status and what that would mean to municipalities across the province.
Okay. Yep. Fair enough. Open for discussion and debate. Councillor Bressie.
Thank you, Mayor Given. I really appreciate the motion to take some advocacy with the province. I can't support this motion as is, though, because I think from what I've heard, the intention, and clarify, feel free to clarify if I'm wrong on this, but I think what I've heard in debate is a desire to have a more concrete definition of what enhanced means. And that's actually not something that I particularly want, because I want enhanced to be a qualitative thing. I know when I go to a doctor, the first time I talk to a doctor, if I've got a problem, I don't expect them to pull out a formula sheet and tell me exactly what's wrong just by looking at my blood pressure. I expect them to look at a whole variety of health factors that are going on and use their experience, and even to some degree use their gut to figure out, am I in need of going to the emergency room to get more tests, or am I in need of just going home to calm down and relax? And for me, I really don't want to nail them to a specific definition, because I want them to be able to use all the very complex factors that go into this. However, if this motion was amended, or if it failed, another motion was made to say something like direct the mayor to write a letter to the province requesting more guidance from municipalities as they wade into mandatory masks, so that we've got better information next time this comes to us, because we do have a sunset clause in here. I'd be very supportive of that. I just think this particular motion isn't quite where I needed to get to be to support an advocacy position.
Okay, thanks, Councillor Bressie. Other discussion, debate? Councillor Clayton.
Thanks, Mayor Given. For many of the reasons, as Councillor Bressie noted, and as well, I think that a couple of the variables that need to be identified in what enhanced status means, the rate of infection, and as well as where the infections are stemmed from, and so if our number is assessed and it's isolated cases, etc. There's a lot of variables in coming to enhanced status. So, I appreciate what you're doing here, but I think that more defined parameters that would get us to enhanced status is important. So if the letter specifically asks for the defined sort of parameters, or what the variables are, that would make more sense to me than asking as your motion is stated right now. So based on that, I can't support it today.
Okay, thanks, Councillor Clayton. Any other discussion or debate on the motion? Seeing none, Councillor Friesen, do you wish to close?
Yeah, thank you, Mayor Given. So basically, I laid out the motion as simply as I could possible. I could have been more specific with it, but the reason being is because it's very vague as it is. So the things that I think we can define right now and that are measurable are the infections per 100,000. At the bare minimum, I'd want to know what that pertains to in regards to enhanced status. What else I'd like to know pertains to enhanced status is in regards to any additional measures that would be taken besides lockdown measures and other stuff like that. Would we be building temporary hospital facilities in the context of Grande Prairie? Would we have a quick opening of our regional hospital? These are all things that, we could detail things down, but the province knows at least at somewhat of a level of what would trigger an enhanced status and an enhanced reaction to COVID-19 or any other infectious disease that may be running through our communities. And I think it's important that we know that. As far as specificity and ensuring that I lay it all out for them, I think just by keeping the motion simple, we're not henpegging the mayor into writing something that is just asking for these stats What we want to know is really how do they define it, how do they measure it, and how are we able to read those measurements and definitions and apply them into our community. So for all those reasons, I would like to see, that's why I kept it vague in the motion, but if somebody wants to try, if this one defeats, I'm more than happy with that. But currently I'm not happy with having no definition for enhance. And I think municipalities, if we're going to have these things fall on our shoulders, such as mandating masks in our community, we should at least know what the last step and the step that none of us want to get to is with the province. So, and that needs to have a definition. And the only way we get that is by asking.
Thanks, Councillor Friesen. For that close, we'll call for the vote. All those in favour? I see Councillors Friesen and Palat in favour and opposed. And I see the balance of council, Councillors Bressie, Friesen, myself, Councillor Clayton, Councillor O'Toole, Councillor Blackburn, and Councillor Minhas opposed. The motion does not carry. Do we have any other motions arising? Councillor Friesen.
Thank you, Mayor Given. I believe that I do have a motion, but I would like to, if Director Manuel is available, I would like to ask him just for an update. I know that during the early days when we had lockdown and there were a lot of uncertainties, we did have a couple of great programs, including the Business Ambassador Program and the Community Cares Program. I understand that those haven't really gone away, but I'm wondering if Director Manuel could speak to the where they're at now, please.
Certainly, I can provide an update there. What I can advise is that I have checked and confirmed that both of those programs are still being coordinated and administered. I would say that both remain somewhat undersubscribed at the moment without any significant new impacts, I guess, related to COVID since the provincial relaunch. At this point on the Business Ambassador Program, it's primarily a wayfinding program to help businesses that would be interested navigate the various programs and services that are available to them, and also provide guidance to resources that talk about the physical measures that can be taken within their workspaces to reduce risk. The Community Cares Program, that program itself, when it was early established, we weren't too sure what levels of government intervention from the province or from the federal government would be. To date, those have been very robust, as was pointed out earlier by one of the councillors. So to date, that program itself hasn't had to draw a whole lot of resources towards it from the municipality. That being said, we are well positioned that if situation is to change and people's circumstances warrant, we can certainly be involved and help direct people appropriately.
Thank you, Mayor Given. Thank you, Director Manuel. So with that, I would like to suggest that just in support of the city's response to COVID-19, I move that Council direct administration to enhance messaging in regard to the mandate and to the availability of both Business Ambassador and the Community Care programs.
Okay, so motion directing to administration to increase, so you actually had three parts there, increase information about the messaging about the mandate.
The mandate, yeah, but also the availability of the Business Ambassador and the Community Care programs, and I can speak to that if that's in order.
Yeah, by all means.
Thank you. So my concern here is that what we're heading into now, Councillor Blackburn didn't allude to it, he stated that he's concerned about a second wave. I share that same concern. It's not a fear, it's a healthy respect for what may happen as we draw into close quarters. And what I reasonably foresee is that businesses who, if our case counts rise, we may have businesses who want to really get in order what would be required of them should the mandate of masks be triggered. So should we hit that 100 case or active case or enhanced status? But also there may be individuals in the community who are vulnerable and feel, whether it's financial access or not, but they may have barriers to access of goods and services for other reasons. For example, just simply not feeling terribly safe to be out in the community if our case numbers are up, but the mask mandate hasn't really kicked in yet. So I just really would like our businesses and our residents to be aware that we still have these programs available. We care about them and are concerned about how they do, and that's why I make that motion.
Okay, thanks, Councillor Friesen. Open for discussion, debate on the motion. I find it difficult to support the motion because of the first part and focusing, asking administration to increase communication on the mandate. I think I'm particularly concerned about any focus on that, given that we're actually not mandating anybody to do anything yet. I think that there's will be media about the fact that we've passed the bylaw and about what it means. I would be happy to support a motion that was directing administration to increase promotion of those other two services that are available. So those two I could get behind, but that first bit just sort of clouds it a bit for me. Councillor Friesen?
Thank you for that comment, and I don't disagree with you. I would be happy to amend my motion to drop the enhanced messaging in regard to the mandate and just have council direct administration to enhance messaging in regard to the availability of both the business ambassador and community cares programs.
Okay.
So amended?
Sure. Your own motion. I really appreciate that. I can't make amending motions, but I appreciate the fact that you're willing to do so.
Yeah, that's fair.
And I'd be happy to support the motion in that case. Any discussion or debate on Councillor Friesen's motion? I don't see anybody in the room, or Councillor O'Toole.
Yeah, I do support it the way it's written now, as the way you proposed it before. I was debating if I wanted to support it or not. I do think that we've now passed this. We need to get the word out that we've done some stuff and explain to the business community where they are in this situation. So those were the people that were mostly concerned when I talked to them. How do I handle this? And I truly believe that this may be a big difference in the attitude of the business owners. Thank you.
Thanks, Councillor O'Toole. Again, I don't see anybody else, so I will call for the vote on Councillor Friesen's motion. All those in favor? Okay. I see that motion carries unanimously of all members of council. Councillor Bressy.
Thank you, Mayor Given. I'm going to try a motion myself, and that is I would move that council direct administration to report to the appropriate standing committee with a proposed plan to increase efforts to encourage residents to practice social distancing, hand hygiene, staying home when sick, and voluntary face coverings should the city or the county move into watch status. And again, just that's report to the appropriate standing committee with proposed plans to increase efforts to encourage residents to take on a number of actions. And kind of the intent with this is we passed a bylaw tonight that I hope never, ever, ever gets enacted. I hope we never get near 100 cases. And I really do think that we'll see a lot of change in our community when we hit watch status. But I'd also be surprised if we didn't see a change in us as an organization if we ever hit that watch status. And I'm definitely open to any friendly amendments people might have, but I hope that when we hit watch status that we're doing things like ramping up our business ambassador program and it not being a, hey, come to us, but doing a better job of being out there with businesses. I hope that we're doing a good job of making changes in our city facilities to help people remember that, hey, we really need to get these numbers down again. I really think that there is a role for us. That watch status, I didn't support us mandating anything, but I do hope we see voluntary changes at that time. And we as an organization should be providing leadership if we ever hit that watch status. And so I'd love us to talk about what that leadership might look like well before we ever potentially hit watch status, not if we hit watch status.
Okay, thanks, Councillor Bressy. Councillor Clayton.
Thanks, Mayor Given. I guess my question is for Councillor Bressie. What is different from your motion to what we're already doing? I mean, Council has already approved a marketing campaign that is very clear on, you know, this is how you wear a mask safely. This is what we suggest you do when you're going in large groups. And so maybe the messaging needs to be tweaked a little bit in order to include some, you know, some watch status reminders. But I think the overall communication and marketing plan is sort of in place. And so maybe it just needs to be enhanced a bit.
If I may, Mayor Given. Yeah, and for me, that's why I'm not giving specific directions to administration in terms of plan to do this. I'm saying, hey, tell us what you're going to do. And maybe that is just we're going to enhance the current things we're doing. Maybe it's, hey, we've got these media buys and we're going to increase these media buys if that happens. Maybe it's, hey, we're already running a business ambassador program, but we're going to reprioritize staff to increase that business ambassador program. Just, I think that I appreciate we're already doing a campaign. I'd be very surprised, and I think lots of our public would be disappointed if nothing changed if we ever hit that watch status. And so I'd like us to have the conversation now about what are our expectations as a council that changes when that watch status happens. And I think the best way to start that conversation is by asking administration, well, how would you propose things change if we hit watch status?
Yeah. Thanks, Mayor Given. I appreciate your intent here. I guess, you know, an update on the program would seem appropriate. I don't know if a plan is necessary. I think that I have full confidence in what our communication department will put out there, and our organization understands how important this is. So to have a whole plan or even a report on what's going to change, I don't know if that's necessary. I think that, you know, if you wanted to have a motion to get an update on, you know, how the communication plan is going and how it's working, and if there's, and what the next steps look like, I think that's maybe just a verbal update, but I don't know if a report or a plan is necessary since there's already the works in motion. I can't support that motion.
Okay, thanks, Councillor Clayton. Councillor Palat.
Thanks, Mayor Given. I actually am going to support this motion, and I think for me, what I'd like to see is back to Councillor Friesen's postponement motion. I think this is a topical way for us to have this conversation yet again. I also think there's an opportunity here for administration to come up with ideas, and some of them might cost money that we don't have in the budget. And not that I want to see us spend a bunch of money, but I also think it's just like when schools open, it's very unrealistic to think that we're going to hit watch status and we're going to be able to do a blanket marketing campaign unless administration knows there's authorization to spend more than maybe what they already had. This might give them the ability to come and say, here's what we'd like to do, here's what we can afford to do. And I think that's an important conversation for us to have. I'm not saying I want to spend a bunch more money, but I think we should be having that conversation. And I don't think it's a bad thing if there already is a plan in place for it to be presented for us, and that's a public document. It's another thing that we can promote. So I think it's a good motion.
Thanks, Councillor Platt. Yeah, I think I need to ask a question of administration, sort of the status. We're assuming, we're making a bunch of assumptions about what they do or don't have, about the money they do or don't have. And so I'm curious, Director Bork, what approach has administration taken to this point with respect to the public information campaign? And what would you imagine going forward? I'm trying to understand what additional latitude administration might need from council, or if they feel that they would need additional latitude to enhance communications if the city were to progress with increased number of cases.
Thank you, Mayor Given. When we brought the first proposal last month, talking about the voluntary campaign, we had anticipated that council would be making some further decisions, and so felt that we had enough latitude and enough funds to at least start that. As you have seen, it's been on the lower scale in ramping up the voluntary campaign. Our intent, if it was to go to the watch list, would be to not just switch our buys, but also to enhance the buys. There will be more frequency, there will be more signage. We would also be talking about some other options to attract or to make sure that we're connecting with people who aren't on social media or listening to local radio stations with some specific signage at the entrances to the city. So we feel that with the direction of the bylaw, that we have a responsibility to communicate that to the organization, and to the community, and have enough latitude right now and funds to proceed. If that changed, I would certainly come back to council and ask for further resources or further direction.
Okay, thanks for that answer, Director Bork. So that, for me, I'm comfortable that administration has a plan. They have the resources that they feel that they need now, and if they felt that they were short of resources, they would come and tell us. I'm really comfortable with that rather than asking for an update or a plan or a report, because I think I feel that I just heard one to the level that I need for now. So on that basis, I won't support the motion. I'll just check first if there's anybody else that wishes to speak on your motion, Councillor Bressie. It looks like there isn't, so I'll go to you to close.
Well, and actually, before I close, I've got another question in terms of, we got an update in terms of the media buy, but that's actually not really my biggest concern. I really do have more of a concern in terms of, frankly, the business ambassador program is the biggest one that's concerned to me. If things get heated out there and businesses are all of a sudden dealing with a lot more heated customers, a lot more worried customers, and they're at the front line of doing things, how are we supporting them? And so I'm wondering if we heard some plans to scale up our marketing, which is really great. That's also not nearly as expensive, I suspect, as actually having staff bodies doing something. So has there been any conversation or resources set aside to enhance our business ambassador program if we do go into a second wave and we do hit that watch status?
I guess that would be probably for Director Bork or Director Manuel.
So I don't mind tackling that. In response to the question, I believe the Business Ambassador Program was built with economic development in conjunction with GPREP. So we do have the ability to expand and contract the team as required. So I think if circumstances warranted and we see a greater demand, we do have the internal capacity to really escalate and support that program as necessary.
Yeah, and so then just speaking in closing in terms of, my hope is that we do see significant changes in organization if we do hit at watch status. I would love to see us, it's great to hear that staff's got the ability to expand the Business Ambassador Program. That doesn't necessarily mean they'll do it without direction from council. And what's our vision of that program? And what are expectations when city facilities, If I think there's probably some of us that would expect the Eastlink Center to maybe operate a little bit differently if we hit watch status. I think there's some of us that would expect the way that we message and we communicate and we ask people to respond in our public facilities to be a little bit different if we hit watch status. And I just really think it's important that we're having that conversation now of, if we hit watch status, what is our expectation of the organization? And again, I'm very open to, maybe this isn't the best motion to do it. It's the best motion I could come up with to do that. But I think that is an important conversation. I just really would hate to see us hit watch status and all of a sudden our administration's hearing 9 different opinions on what they should be doing differently than they're already doing. And I really worry that that could happen if we don't talk about how this organization looks in watch status now. So I hope the council will pass this motion, or I'll suggest something better.
Okay, thanks, Councillor Bressie, for that close. So I'll call for the vote. All those in favor of Councillor Bressie's motion of direction to administration? Those in favor? I see Councillor Bressie, Councillor Friesen, and Councillor Palat in favor. And opposed? I see Councillor Minhas, Councillor Blackburn, Councillor Thiessen, O'Toole, Clayton, and myself opposed. The motion does not carry. Are there any other motions to come forward on this topic? Councillor Palat.
Thanks, Mayor Given. It just seems like, in light of all the conversation we had about potential downloading, I'm having a hard time that we're not coming up with some sort of motion to talk to the province. And so, and maybe this needs to be internal at first. So I'm going to make a motion that we direct administration to bring back a plan with advocacy strategies for consulting the government regarding COVID. And I'll leave it at that. This could be about, when's our new hospital opening? What do the advanced measurables look like? But I think as our council, if we're not going to start having a conversation about an advocacy strategy with our province regarding COVID, I'm very disappointed, and I don't think that's what's doing our community. We're not serving our community right now. We haven't been in council chambers for 5 months, 6 months almost now. We haven't talked about advocacy for quite a long time. And with some of the downloading that's going on in other areas, not just COVID, but COVID specifically right now, I'd love to see administration come and tell us what they think we should do for advocacy strategy so we can bring it to a priorities meeting or council committee of the whole, wherever it needs to land. But I think the community needs to know that we're being very serious about working with the province right now. And up till this point, I can't tell people in the community that we are. We're just, in my personal opinion, we just haven't had a lot of advocacy strategy. And so it's a little bit disheartening to me. So I'll leave the wordsmithing up to friendly amendments that'll probably come from this, but I would just like to see this be internal, that we allow our own administration to bring back our plans so that we can have a debate on that and we can decide how we want to move forward with advocacy. But I think we need to set a tone that we need to be having some advocacy with the province.
Okay. Can you just restate the wording of your motion as you propose it, Councillor Plott?
You bet, Mayor Gibbon. So direct administration to bring back a plan with advocacy strategies for consulting the government on municipal COVID. I'll leave it at that. And then the specifics, I would hope that would include what's happening with the hospital, how we get measurables on enhanced status, those sort of conversations. But at the end of the day, I just want us to have a conversation about advocacy strategies with our province.
Okay. Open for discussion and debate. So in terms of wording, Councillor Plott, for me, I will say that a motion to have an advocacy strategy to consult with the province. Like, I think if we're going to advocate, we should advocate for something, to advocate that the province provide more information to municipalities to enable them to respond to COVID. Like that's, so I just, it needs to be a little bit clearer because advocating to consult is, there's sort of different things. And so if we're advocating for something, I need to know what that something is that we're advocating for.
So for me, I don't know what that is. I'm sure hoping administration can put some time in our calendar that we can have that conversation. That's, for me, the intent of this is just to have administration come with us with a report of what they think we should be advocating for on behalf of our community so we can have a conversation about it. And so I'm just trying to find a way to get some dialogue started for this group to be talking about advocacy to the province. And so that was the intent of this motion. I'm fine with amendments. I'm just wanting to get us talking about advocacy. So if that wording doesn't work for council, fine, defeat this, but come up with your own wording. But I sure hope we leave here tonight with something going out to our community that this group of, or group in our council is going to work with the province on an advocacy position that we haven't come up with yet in the last 5 or 6 months on certain very topical things in our community.
Okay, thanks, Councillor Plott. Councillor Clayton.
Thanks, Mayor Gibbon. I appreciate the intent here from Councillor Plott. I think it's absolutely a priority that our council, with approximately 13 months left in this term, need to advocate. And I think that our strategy, due to priorities on many other things, has sort of fallen on the wayside. So if this motion needs to be getting administration to get it into our calendars, to have a council at the next council committee of the whole to discuss our advocacy priorities, so be it. If it needs to be at the next strategic priority working group, which I'm not looking at my calendar, so I don't know when that is, but I think maybe the conversation is just to CAO Galante. I'm recognizing that this council currently feels that there isn't an advocacy strategy, and so it's obviously not a vote. It's just a discussion right now. I don't know what the appetite of other councillors are, but I absolutely support the intent of Councillor Plott here. I think it's very important, especially now, for us to have a very clearly identified strategy, whether it's advocating with Ministry of Health in what the communication process looks like between the municipality and the NHS. If it's advocating, with the Ministry of Transportation to talk about the next section of the bypass, whatever it is. But there's many priorities that this council has, and currently the one piece of it that we don't seem to have is the advocacy strategy. Tonight we appear to be back to work, and I think that the next step of us being back to work is to have a clearly identified advocacy strategy. So what that looks like, if it needs a motion, I'll leave that up to you, Mayor Gibbon, but I support the intent here.
No, Councillor Plott's made the motion, so I'm not making the motion. Councillor Plott's made it, so that's what we're debating right now. Councillor Friesen.
Yeah, thank you very much, Mayor Gibbon. I 100% support the intent and even the motion, worded right or wrong. I think the key word is advocacy and strategy. Those are the two key words. There's lots that we've talked about here tonight as far as getting answers from Alberta Health Services, and the province of Alberta. It doesn't just start and end with COVID. It continues on with our Grande Prairie Regional Hospital. It continues on with infrastructure. It continues on with programming. It continues on with our economic recovery. So there's lots of things that we can advocate to this provincial government that are in their wheelhouse that they want to talk about. And, you know, obviously maybe the health stuff they don't want to talk about as much, but the more that we are pressing to get answers and give answers to our community from our highest officials that legislate us through the Municipal Government Act, I think the better off we're going to be. Councillor Platt and I have talked about this it's been close to a year now, and I know I'm not the only one on council that he's talked to, so I will 100% support this because it is important for Grande Prairie to have and establish a voice and to have that clear line of communication to the province to tell them what our community needs. Thank you.
Okay, thanks, Councillor Friesen, Councillor O'Toole, then Councillor Clayton.
Yeah, thank you, Mayor Given. I will support some sort of meeting where we can discuss some advocacy with the province. So however that works out, it works out. But that's where I fit, and I think it's a good thing that it was brought up tonight.
Okay, thanks, Councillor O'Toole. Councillor Clayton.
I know there's currently a motion on the floor. If Councillor Platt would allow me, I have something that may be a little more in line with what council is talking about. I would, you know, I'm not going to make a motion. I'm just going to make some suggestions. That your motion would direct administration to bring an advocacy strategy back to council that aligns with council's current priorities. So it would be an advocacy strategy brought back that aligns with our current priorities, and it's a report. You know, administration bring back a report that that is an advocacy strategy aligning with council's current priorities.
Okay, so that's Councillor Clayton's suggestion of what she would make as a motion or advise. I don't know if that changes, Councillor Platt, what you want to make, or whether you want to withdraw in favor of Councillor Clayton's motion, or if you want to amend, or if you want to have the vote on yours. I'll leave it to you, and then I would go to you to close. There's nobody else. Thank you.
I'm fine with that amendment. Wordsmithing's never been my strength, and I was trying to decide here just to make sure we had the conversation. So I'm fine with that amendment. I think it probably fits better if we're looking at our strategic priorities. I think it actually fits better, and it's a good talking point. And so I just want the conversation to have more than anything. So that wording probably does seem better to me, and I think it gets to our priorities. So I appreciate the friendly wording amendment.
Okay, so maybe what would be the cleanest is if. Councillor Platt, are you okay to withdraw, and then we'll let Councillor Clayton make that motion? Because you said COVID.
Yeah, you know what? I'll withdraw. If she's got it written up there rather than wordsmith, I'll just withdraw mine, and she can move forward with hers.
Okay. Councillor Clayton.
Thanks, Mayor Given. I would move that to direct administration bring back an advocacy strategy that aligns with council's current priorities.
Okay, so that motion is directing administration to bring it back, the advocacy strategy, and specific to the currently established council priorities. Okay. Go ahead, Councillor Clayton.
The appropriate standing committee, where do you think that's best? Is that fine?
I think you don't need to add more words. Just sometimes when we add more words is where we start to get into trouble. Okay, can I see Councillor Blackburn?
Thank you, Mayor Given. I understand where Councillor Platt was coming from, and it really had to do with an advocacy strategy that would connect our council with Alberta Health regarding COVID. And the wording of the current motion just asks for an advocacy strategy and doesn't specify at all what it would be for.
Okay, thanks for that. Councillor Blackburn, Councillor Platt.
Thanks, Mayor Given. I guess my hope, or I don't want to assume here, but when we're talking about a regional hospital that potentially could be brought onto the market at some point that could have a huge economic, social, health impact, I would assume that that would be brought in as part of the conversation from our administration. So to Councillor Blackburn's point, yes, I would love this to be about Alberta Health Services right now because I think that's where the conversation started. I think that will happen if we have a conversation, and I'd love to see, before we decide on it, I'd love to see what administration's feeling for advocacy priorities. And I do like Councillor Clayton's amendment going off of our strategic priorities. I think we'll be able to find easy ways to layer in Alberta Health Services, maybe concerns or frustrations. I also think we'll be able to add enhanced measurables if that's something we want to have. It's just more or less to get the conversation on the table.
Anything additional? Well, Councillor Clayton, I'll come to you to close. I'll say that I support the motion as worded. I think it's, related to our currently established priorities, which are pretty broad. And, I'd also observe that we have had a number of direct outreach points to the province over the last while, passed by council, directing me to write letters to the Premier and to other ministers on a number of different topics, inviting them to conversations. And so certainly we are doing some advocacy. I appreciate the intent is to bring that together in some overarching strategy, and I think that's a reasonable conversation, so I'm happy to support the motion. Councillor Clayton to close.
Thanks, Mayor Given. Just to Councillor Blackburn, I appreciate, your concern with it not addressing the initial intent of Councillor Plotz, but with one of our strategic objectives being safety, I'm confident that administration's advocacy strategy would include something from that sort of pillar within our strategic objectives. So as much as I hear your concern, I'm confident that what administration brings back will be inclusive of the single largest issue that we've discussed this term. So thank you.
Okay. Thanks, Councillor Clayton. That's for that close. So we'll call for the vote. All those in favor? Thank you. That motion carries unanimously. Are we ready to move forward through the balance of our agenda? Are there any of the other items? I see council looking like there aren't any other items coming forward on this. So we will move on. We had no public hearings this evening. We did have 2 delegations. Of course, they're both related to the mask bylaw. I think a motion to receive those for information would be appropriate. Motion to receive for information. Okay, thanks, Councillor Clayton. All those in favor? Thank you. That motion carries unanimously with the exception of Councillor Palat, who has had to exit the council chambers. So that motion carries with a vote of 8 in favor, and that was all the votes that were cast. So we'll move through to council member reports. We'll start off with the Alberta Bilingual Municipalities Association and Councillor O'Toole.
Yeah, thank you very much, Mayor Given. Last weekend, I ended up going to St. Albert to meet the members of the Alberta Bilingual Municipalities Association, and we worked on a strategic plan. And I will be giving you a full report here in about 3 weeks once we get it all filed and put into a system that is easy to read. But one of the items that we were working on is a tourism strategy. It's working very well on the east side of the province, northeast side. And we've been working a little bit on the west side where we are, but there's still some stuff that we need to accomplish. We are also working with the southern part of the province. So with that, the Alberta Bilingual Municipalities Association is strong and we have a united voice. So that's a good thing at this point in time. Thank you.
Thanks, Councillor O'Toole, or merci. We'll next go to the Community Advisory Board on Housing and Homelessness. Councillor Friesen.
Oh, I wasn't sure you're going to call my number right now. I have all these cards around. I've been flipping them here and there and everywhere. As I try to find it, so the Community Advisory Board on Housing and Homelessness met on August 27th. I took the place of Councillor Clayton, and here we go. And so we had a presentation there from the North Ridge Street Outreach Program from the new Executive Director, Chris Tabin and Johnny Fortune. They have so there were some questions that were asked. They tried to tell people about the housing project that they were working on, as well as the new outreach program. There was some questions from the Downtown Association as well as myself in regards to new drugs on the street, as well as new people on the street that aren't your typical homeless locals. And they said yes, they've seen a lot of unfamiliar faces lately. They didn't try to bring forward any assumptions as to why. But they did say that with the new crowd of people on the streets, there's also coming new drugs that are becoming issues. Benzos, ketamine that they're finding in heroin, or sorry, benzos and ketamine within heroin is one of the new things that they're pushing for. Just awareness on with the street population, because if you're buying the drugs and it's tainted with something you don't know, you could get yourself in big trouble. The presentation was really good. There's a good question and answer there. We did get an update from about the Prime building. It should be ready to go for our October MAP programs, all ready to rock and roll, according to Catherine Shepard. I hope I got it. That's Schmidt. It's Schmidt now, sorry. Also, there was a new thing that got added into the Rotary House. It's the opening of the Prime building as well as Oasis. They are now giving an option for couples to bunk together on a MAP program at the Rotary House, so that they're not separated, one in the women's and one in the men's, so that they can keep together. So that was really, really good to hear. There's a lot of talk about recruitment as well at CAB. They are missing some people that they think could be a benefit to the advisory board, and that was a youth representative, which we know is tough. We did make suggestions from Sunrise Health Youth Emergency Shelter to come take part, as well as people involved in family violence, seniors, and as well as immigrant services. Now, typically, Steve Madden from Grande Prairie Foundation sits on the CAB, but not as a voting member. He just does it to be abreast. So I propose it to the board to consider, perhaps, since I am the alternate to Councillor Clayton on CAB, but I'm also the representative on Grande Prairie Foundation, that perhaps I might be able to find a suitable way into that discussion as a voting member. But again, I said, let's leave it for now. And of course, I like popping in on those meetings as much as possible. And that pretty much does it, except for an update to the advisory board on the federal COVID funding of $551,000, how that went to help social distancing in various shelters across the city. But as council, we were already aware of that. So shall I go on? I've got a couple other, and they're pretty quick updates.
Well, actually, the next consultation was the Downtown Association, and then we moved to Councillor Clayton for Economic Development Advisory.
Beautiful. Well, actually, there was a great agenda, but it largely got taken over by the conversation about masking and the business community's willingness. There was a bit of dissension there. When it came down to it, to support the businesses, though, members of the Downtown Association did vote as a 7-1 in favor of the city implementing some kind of masking policy and bylaw, so that business owners felt a little bit more secure in being the authorities within their business spaces. The other thing that we were talking about is the potential for the Halloween walking parade for the kids to potentially be canceled. We are considering this strongly because of social distancing measures and, large group gatherings, and also kids walking up and down the street getting candy from strangers. I don't want to say we live in such a fearful society that we can no longer dress up our kids in costumes and go to our neighbors' houses and collect candy, but these are the considerations that are being made nowadays, and it is very unfortunate. But a little bit of a brighter note on the Vegas night. There's some hope for Vegas night and doing some enhanced methods, both online and otherwise, maybe even extending it a couple extra days rather than having just a one night, make it a 3-night event so that people don't come out in droves, so that they come out over the course of 3 days and hopefully spread themselves out. So those plans are still being worked out. And that is what I have for updates on the Downtown Association.
Okay, thanks, Councillor Friesen. Councillor Plott.
Thanks, Mayor Given. I just wanted to give an update on our Economic Development Subcommittee. We had met a few weeks back here. I'll start out by throwing out a huge thank you to Cindy Park, the chair of that committee. She's really kept us meeting regularly. A minimum once a month we're meeting as a subcommittee to try to feed ideas to the bigger committee. This subcommittee did have a lot of discussion about new ideas that we're looking at of ways to spend the additional fund and bring it to council. So there'll be some recommendations from our committee going to the main committee that would, the steps to get to council. It was also talked about that the intake through the facility enhancement programs that we had approved already is already seeing significant uptake. So happy to see that it's getting subscribed already. So that was good to see. And that was the bulk of our conversation. The other meeting I had that unfortunately I want to thank Mr. O'Toole for stepping into me on pursuit of a protective services meeting. I had an in-camera down to our airport meeting, which I can't discuss yet, but some exciting things we'll hopefully be discussing in about a month.
Great, thanks for the teaser. Appreciate that. Next, we'll go to Grande Prairie Regional Tourism Association, Councillor Clayton.
Thanks, Mayor Given. Just a quick update. I want to encourage people, if you haven't had an opportunity to check it out already, that you go to the Grande Prairie Regional Tourism Association's website. They've had a rebrand as well as a new sort of approach. Their big campaign right now is called the Grand Plan. And so what it is, it consists of ready-made day trips in the Grande Prairie region. So, you know, as we sort of head into fall, the approach will change a little bit to more fall-focused excursions and day excursions, but it really shows you based on what you are looking to do, how old your children are, what it's sort of your intent is, if it's out-of-town people that you've brought to the region that you want to show different things. So it's a great sort of place to find local experiences within the Grande Prairie region. So if you haven't checked it out, I suggest you do. Thanks.
Thanks, Councillor Clayton. The next up was Councillor Bressy and Grande Prairie Sport Connection.
Great, thank you. One exciting update is that the Sport Connection, one of the priorities has been applying for grants and trying to get money brought into the city, not just taking grants from the regional municipalities. And the Sport Connection just found out where it's getting a $35,000 grant to put free after-school programs in some of our schools that are the most needful of recreation options. And it's a cool program where there's going to be 10 to 12 college age-ish people trained to coach, and so they'll get some certifications and some life skills. Then they'll go run some after-school sports that will last a few weeks. Of kids will learn sports at their schools. And then the program will provide free busing if COVID allows us to go and compete against other schools. So it's a chance for kids that can't afford to play club teams or can't even afford the fees to play a school team. They'll have a free opportunity to do sports. That's really exciting to me. It's really, really exciting to me. Then the plug I want to put in with the Sport Connection is next week the board's meeting to do its strategic planning exercise. And I think the organization very much does realize that we're very grateful to the City of Grande Prairie for its support, and we were created to support municipalities, and including the city. And so we're very happy to pivot and do what we need to do to support the needs of local councils, and especially this council. So if any of my colleagues have something you'd like to see out of the Sport Connection, please let me know in the next few days so I can bring it to our strategic planning.
Thanks, Councillor Bressy. Councillor Friesen, you did reference Grand Spirit Foundation earlier. I think you said you had a Grand Spirit Foundation update. Yeah, just a quick update. At the last council meeting, I made the community aware that there was a mild outbreak at the Heritage Lodge Manor. Just updating on that situation, as recently as this past weekend, the lodge manager who was being tested for COVID came back negative with their tests, as well as the other two Alberta Health Service workers. They are now clear to go back to work, and the AOK has been given for people to start exiting out of self-isolation within the lodge, as most of the COVID tests have come back negative. Great, thanks very much, Councillor Friesen. I'll provide a brief update on the ICF Negotiating and Steering Committee. As Council knows, Councillor Friesen, Councillor Clayton, myself, and Councillor Minhas as an alternate are the negotiating committee. Some members of council have been able to participate and watch in some of those sessions. Just a bit of a status update, nothing in terms of the details, but as council member, we've had over a year of negotiation over the last year or so, and we're now into a phase that's required under the Act of mediation. The city has just last week completed the most recent 2 out of our total of 6 days of mediated sessions. So we have 2 professional mediators that have been assisting the city and county to discuss a range of different issues. Unfortunately, I don't have any new news to bring forward at a public stage at this point. Just to update my council colleagues that those meetings have continued, and we'll be looking forward to bringing additional information when and if it's available. Councillor Friesen, I think you're the last on my list as well with the Nighthawk Area Recreation Board.
Yeah, thank you very much, Mayor Given. It was a busy week right before I left for my birthday, but we did get a little bit of an update from Parkland Geotech. Working with Alberta Transportation, they were able to provide us lots of data to Parkland dating back to the 1963 years based on the road and the area map so that we could see how the slope has been moving throughout the years. Now, of course, we don't have any slope estimates yet, and we're still waiting for Parkland Geotech. I really wish I had some information for you there because that also will inform our insurance company to see how much of that they may be able to pick up of the tab, which we're estimating right now due to the landslide and the loss of the chairlift at about $1.5 million, which is really not so good for the hill. But the great thing is they're still opening this year and just on a limited run basis, and they have been undertaking several fundraisers. The first fundraiser that they had on the 50-50 draw sold out in 8 days. The second fundraiser for a $20,000 50-50 with $10,000 going to the winner just sold out within 13 days. On my birthday, in fact, it was a great birthday present. And then just today, they drew one of the winners and they started their third 50-50 draw for $20,000, $10,000 to the winner as well. And they're encouraging everybody who is paying attention here around to fill up your car and buy a ticket to the 24th annual Nighthawk Comedy Night that will be held on September 26th at a location near you. That is all.
Okay, thanks, Councillor Friesen. I think that was all of our external committee reports, unless Councillor Blackburn or Councillor Minhas had any. And I think I checked with you before, and you don't. See Councillor Blackburn nodding. Then we can go to Councilmember Roundtable if we're really up for that. Councillor Plott, I made eye contact with you, so we'll have you go first.
All right, thanks, Mayor Given. I guess the highlight for me the last couple of weeks is actually regarding something Councillor Bressy talked about with our potential expansion of Revolution Place. And so for me, this is one of the biggest, could be the biggest thing that we do in our term. So I got in touch and I've been able to work with a few times with a group called International Coliseum Company, a group that's built several other facilities in the province already, well connected to WHL and other things. And so I'm urging them and hoping they will come and speak to us as council or at a committee, just to give us more oversight on some things, some pitfalls that they see, some challenges they see, but also some huge opportunities that they were excited about for Grande Prairie to look at an expansion. So it's been some exciting conversations. It's been neat looking at some of the projects and some of the modeling they've done for other municipalities. And so it was a fun conversation to be part of. Pretty big picture guys, connected to some pretty big people. So I think it would be a cool thing for our community to have these guys up and pitch and talk to us about what they see us looking like for our future arena district or future arena expansion. Thanks.
Thanks, Councillor Plott. Councillor Friesen.
Ooh, back of the bus first. Look at that. That's where the good kids today. I didn't actually do too much. I did manage to take a week off for myself to go recharge the batteries in the mountains of Revelstoke and still stay as engaged as I could be with the City Council, especially around this mass debate. The only thing I really wanted to say, and I'm going to say it today because this is the 4-year anniversary of my own father's passing, but my heart really went out to Councillor Yad Minhas, who suffered a loss in his family. His brother Peter passed away. They just had the service for him this past weekend. My condolences go out to Shaminder and to Yad and to all the Minhas family that was impacted by this. It is never a happy moment when you lose a family member. Just know that not just me, but every member of council and every member of the community who knows how good you guys are, we're behind you and we're all giving you lots of love and support. So call us if you need and give me a hug if you want. I'll wear a mask if I have to. Thanks.
Thanks, Councillor Friesen. We'll go to Councillor Blackburn.
Thank you, Mary Given. I guess the only comment I'd like to make is regarding the hundreds of emails that we've received over the past several days and weeks. And I want to say a public thank you to all of those people, regardless of which side of the debate you were on. you had the heart to talk to council about it in one way or another. And that shows community. And people know that I have a great deal of compassion for the people in our community. And although sometimes the rhetoric was a little hard to deal with for any of us, those of us that were receiving the letters and those of us who are sending them, it all has to do with being part of a community and caring for it. So a big thank you to those several hundred people who participated in that process. I don't have anything else. Thanks.
Okay, thanks, Councillor Blackburn. Councillor Minhas?
Oh, thank you, Mayor Will Given. I was busy with my brother's funeral stuff, and I really appreciate all the council helped support me on this one, and condolence. Special thanks to Kevin O'Toole. He stand with me and came so many times to ask me help and stuff, and so was Eunice. Other than that, I appreciate like what Clyde said, those people took the time and put the emails, either you wanted the mask or not. But finally today we did something. At least it'll be put back burner and get move on to it next project. And now as we have a budget coming ahead, we get to look more serious stuff. Other than that, that's all my last 2 weeks gone.
Okay, thanks very much, Councillor Minhas. Councillor Bressie?
Thank you, Mayor Given. I actually don't have anything to report. I know that I really made it a priority to respond to almost every email that we got, as long as it didn't have threats in it, or as long as it didn't have lots of name calling in it. Or unless I messed up Outlook somehow, I responded to every email, and that led to a lot of coffees. And so honestly, this mask thing for the last 2 weeks has been all my council time and energy plus some. And so I don't have anything to report to council other than, like Councillor Blackburn, I think that I want to echo that the vast majority of people I talk to on both sides of the issue really do care about their community and really do care about their neighbors and really did want council to make a good decision for them and their family. And whether I agreed with them or not, I really do appreciate them dialoguing with elected officials. And I don't know if it's been an interesting last couple of weeks that I don't know if I want to live those last couple of weeks again. But it's also been a couple of weeks where I've had some really great conversations with people that really love this community and really love their neighbors. And it was humbling to see some of the kindness and the grace that I've seen come out of this heated situation. And so don't have much to report, but I'll leave it at that.
Thanks, Councillor Bressie. Councillor Friesen?
Thank you, Mayor Given. More of the same. I've not had such a rigorous pace of engagement since campaigning, and to say that I'm exhausted is a bit of an understatement, but also energized by the interactions that I had. I particularly appreciated those, in addition to all the messages, those who did take time to call me. I spent hours on the phone and hours at coffee with residents who agreed with me and those who did not agree with me, and those who from whom I differed were particularly important conversations to have, because when we did meet face to face or get together on the phone, it really put the humanity of this into the equation. And I hope that we remember this as we go forward, that regardless of whether we're wearing a mask or not wearing a mask, let's treat each other with respect and kindness and compassion and give each other space to make the choices that we make for with our own considerations and also with considerations of our neighbors in Grande Prairie. And I'm very, very proud of how we have gotten through this last couple of weeks. Thank you.
Thanks, Councillor Friesen. Councillor Clayton?
Thanks, Mayor Given. I don't have a lot to add other than Mayor Given had mentioned we've spent a few days in the last couple of weeks preparing for ICF and going through ICF mediation, and it's, you know, it continues to be an extremely important process that this council is going through, and I appreciate the opportunity to join Mayor Given and Councillor Friesen and Minhas on that. So. Other than that, not a lot to update, and the words that were said by many thanking the residents for the numerous emails are, you know, I absolutely concur with that. The emails generally were of coming from a genuine place. People had genuine concerns. No matter where they stood on the spectrum of what was important to them, they came from a genuine place. There was very few that were offensive, and many of them were educational, as Councillor Thiessen had indicated earlier. But generally, the emails were just people genuinely concerned about our community. So thank you for those emails. And that's it.
Thanks, Councillor Clayton. Councillor O'Toole.
Thanks, Mayor Given. Yes, I did spend 2 days with the negotiation with the county of the ICF. I found it quite interesting. I left early on the Thursday and drove out to the village of Hythe as they were rebranding their logo and how they present themselves in the community, and also bragging about the new website launch and their internet system. And they were quite pleased to see myself and Mr. Bressy attend. They thought that we wouldn't be there. And I said that you guys are part of the region. Why wouldn't we be there? And there was a big smile on their face that we drove all the way out there to see them, to witness a rebranding celebration. The Mayor Brian, I've known him for a long time, was overwhelmed with the attendance of people coming to their event. And also we had MLA Minister Taves was out there, and he was quite excited for the village of Hythe doing their rebranding. It was also mentioned that in a few months there may be a vote to dissolve the village of Hythe, and Mayor Brian suggested that to their town members to vote positive in this. It will do the village a lot of good, and Hythe will always be Hythe, even if it does get absorbed into the county. So it took a lot of support, and I think that the village of Hythe is not necessarily the most financially viable community in this area, and they were looking ahead for progress. So thank you.
Absolutely. Thanks, Councillor O'Toole. You know, recognizing the length of the evening tonight, I'll just highlight a couple of things. One actually that's coming. I had a call, connection with the Oilers, reached out, and as a part of the NHL's hub city model with games taking place in Edmonton, the Oilers organization is working with the NHL to connect with northern communities, and so they reached out to Grande Prairie. It appears as though members of the Grande Prairie minor hockey community will have a chance to have a Zoom with an NHL player that's currently still playing. And it looks like that may happen tomorrow night. And so the NHL is working on the plans for these. Just want to let council know that we've offered to be as helpful as we could. They invited me to bring a little bit of a welcome to the community to the start of it. So like the mayor, you always kind of get to do the, hey, welcome, and here's Grande Prairie. And then we're going to send it over to the kids so they can talk to the hockey player. But certainly appreciate the Oilers and the NHL reaching out to make that connection to allow our local kids to connect with some of their heroes. The other thing that I would highlight too is a recent phone call with the new chair of the Board of Governors, Grande Prairie Regional College, Bridget Henniger, just to talk about issues of mutual concern and the college's place in our community. I also had a meeting with the chair of the Board of Aquaterra, Jim Smith, to talk about the upcoming Aquaterra board meeting and some shared issues and priorities that council has related to Aquaterra over the last number of months. And I had an opportunity to have a phone call with the Honourable Minister Tracy Allard, just to get a bit of an update and check-in and share congratulations with her on her appointment to her position. I was also able to share that we had a mid-sized city meeting, mid-sized city mayor's meeting later that week, a couple days after our call. Made the offer to her that you know, the group would be happy to have her pop in. And to her credit, rather than just popping in on the Zoom call, she actually dedicated a half an hour to introduce herself to the Mid-Sized City Mayors group and answer some questions. And so I think speaks really highly of her willingness to engage. And as I spoke to her, she was on the road in Southern Alberta getting out to meet other municipal leaders. And so and she also wanted to relate to me directly, and although it wasn't a surprise at all, that she intends to fully still do her duties as a local MLA. I think that may come from a place of first-time minister. But I appreciate that her desire and intent is to continue to be a fully engaged representative of the Grande Prairie area and the city of Grande Prairie, as well as the Minister of Municipal Affairs. I have no doubt she has the energy and desire to do that. I will wait and see what the demands of the job place on her on top, but I appreciate that she's starting from the right place and have no doubt that she is committed to doing both. And with that, I think we'll call our meeting adjourned.